everyone is good. In Eastern time, good morning, and in Asian time, good evening. So today is an exciting day. We are happy that fifth international conference. It will be a wonderful conference for us, and we are waiting for 2 days program. This 2 days program will be really. It will be a wonderful schedule. There are a lot of international speaker, panel member, and a lot of students. They will presentation their article. So we will be wait and we will see their presentation, and speaker will be present their wonderful research. So it will be a great opportunity for us. I think first to end in 26th October end of day, we will stay here, and we will be try to maintain the rules and regulation. And I am trying to schedule. I am trying to tell what will be the happen. There are a lot of speaker are there, and they will announce their research, and most of them Dr. Parvin Jareen, chairperson of this Bioquantum Academy, and then Dr. Prabhu Kumar Raju, and Dr. Leonardo Horis, and international all speaker from USA, Canada, Asia, Indonesia, Mexico. A lot of countries people will be here, because we know Bioquantum Academy, they are trying to expand quantum medicine all over the world. So this will be the future place for research and for future medicine, and it will be expand Asia to North America to West Canada to East Canada, everywhere. So we will happy, and I am trying to say their topic and title, and it will be today. Our program will start now, and then our co-chairman, she will opening the conference remarks, and then Dr. Prabhu Kumar Raju, he will speak about the role of epigenetic corrections in autoimmune disease, and then Dr. Leonardo Ruiz, and he will speak about 5 to 8 frequency photo acquisite bioenergy and therapy. And then in 12 p.m. we will be a break, and 12:15 we will find a wonderful speaker from Dr. Maria, and then Dr. Faisal Gira, and then we will find Dr. Karim and Haggard. A lot of international speaker will be today. So all are welcome. One by one, everybody are joining here. So we are excited to know their voice. We want to hear their research article. We want to hear about homeopathy, future medicine. In my country, in Bangladesh, 40% people are use homeopathy, and most of them are women. So I am working for women's health. I am personally, I am Dr. Niamatullah. I completed my bachelor in homeopathy, and this is I am a second generation of homeopathy. My father was the homeopath doctor, and I am trying to in my country expand homeopathy in rural area. This is the wonderful collaboration by Bioquantum Academy to introduce everybody. So I hope it will be a great opportunity and energetic program. And here a lot of candidates are here, and all are welcome. Dr. Christina, Dr. Faisal Gira, Dr. Maria, and Hidar Alice, and Dr. Tara, Prathomi, Ohiani, Caroline, and David. Wow, everybody are welcome. Dr. Benny, Dr. Caroline, Dr. Bayat, Tetel, Indonesia, Suraya, Dr. Lina. Wow, everybody are welcome. And Dr. Lina, Muhammad Heril, Desi Christiani, Ginny Garanua. Wow, it's a really exciting moment we are passing. And I hope everybody are joined here for homeopathy and share our experience, because in COVID session we saw that when there are no medicine, only homeopathy, we use arsenic album, and it really wonderful um, magic in my country. I use, and I also expand in our national television about homeopathy. Not only homeopathy, I said arsenic album you should use. So internationally, this is a wonderful platform to expand everybody to share their experience. I hope you will enjoy. And now I will take to the floor our chairperson of Bioquantum Academy. She will discuss, she will speak about everything, you know, uh, Dr. Parveen Jareen, PhD, DHMS, and DNM and DIM. She is the president and dean and faculty of Bioquantum Academy, founder of Bioquantum Academy, and founder of International Educational Platform of Homeopathy and Integrative Medicine, Canadian board certified DNM, Doctorate of Natural Medicine, and PhD in Homeopathy, Classical Medical Homeopath, Head of Department of Homeopathy, Integrative Medicine. So now time to her, and he will discuss what will be due in our next session. So I hope you will enjoy our whole day speakers voice. So let's go.
Thank you so much, Dr. Ola. It was for your wonderful introduction. And by the way, Dr. Ola is also a homeopath, and you see that how much passion he had in his introductions about our program and about the academy. Thank you for introducing me as well. And
Thank you.
I would like to, warmest greetings from Canada to all of you. Good morning, good evening, my respected colleagues, esteemed speakers, scholars, distinguished guests, and dear participants. It's my great pleasure and honor to welcome you all to the 5th International Conference in the World of Homeopathy and Integrative Medicine organized by the Bioquantum Academy on the topic of cancer, autoimmune advanced phase of disease today and tomorrow. This conference topic reflects not only our ongoing quest to alleviate human suffering, but also our commitment to understanding health in its deepest and most holistic sense. As we gather here today with scientists, practitioners, educators, and visionaries from around the globe, coming together with one shared purpose to explore how homeopathy and integrative medicine can unite modern science with timeless wisdom in the service of true healing. In a world where disease is often viewed only through a physical or biochemical lens, our conference invites us to look beyond to the energetic, emotional, and spiritual dimensions of wellness. The conversations and collaborations we begin here will shape the evolution of integral approach in future healthcare for our next generations to come. I wish to express my heartfelt gratitude to our keynote speakers, presenters, research students, panelists, and participants for their valuable contributions, and to the conference organizing committee for their tireless efforts in organizing this transformative event. Let this last conference of the year 2025 be a celebration of knowledge, compassion, and innovation. May it inspire each of us to continue advancing the art and science of healing for the benefit of mankind. Thank you, and I wish you all an inspiring conference ahead. Thank you, everyone. Goes back
Thank
to
you.
the Dr. Ola.
Mm-hmm. Thank you, Dr. Parveen Jareen.
Yes. Okay.
To introduce and opening this ceremony, opening the conference.
I think the first speaker, Dr. Kumar,
Yes,
still hasn't joined yet. But if everybody agrees, I can go ahead and start my presentation.
Okay.
So
Okay. Now the time is Dr. Parvin Jarin, and it will be a great opportunity for us. And she will speak about the power of homeopathy in treating cancer, advanced phase of disease, autoimmune conditions. So it will be a wonderful discussion, wonderful speech, and we are waiting to hear from Dr. Parvin Cherin, because in cancer, in total uh, whole world, cancer is increasing day by day, but it's really expensive disease, expensive for patients, and a lot of patients are died without treatment. And in cancer is not a real disease, it's a mismedication or something. So what happened, it will be said our honorable speaker. So now I will give to floor to honorable speaker, and she will discuss about cancer and mismedication.
I just want to make sure if Dr. Kumar is, joining the conference anytime, I can stop. So, but if not, then I go ahead. So, Dr. Ola, please just check if in the next few minutes, Dr. Kumar is joining, so I have no problem to stop because it's a scheduled for the first speaker. Okay, thank you so much. We chose the topic cancer and advanced phases of disease, such as autoimmunity. The reason I chose this because for the past 30 years, they tried to shut me up not to talk about cancer. So when I graduated, they tried to announce it that homeopaths are not supposed to talk about cancer, and two things: one cancer, one vaccinations. So these are two things that I never stop talking about it and never stop raising awareness. So because if a homeopath has a fear of talking the truth, is not called a homeopath. So it's not just the homeopath. Whoever in the field of natural medicine or in the truth is like a practicing with the truth and not talking about the truth, and you're suppressing it. So at this point, and that's why most of the time, I had events to raise awareness. So yes, as Dr. Olaf introduced the Bioquantum Academy and also introduced me, I think nobody needs to know more about me. And again, welcome to the 5th conference organized by the Bioquantum Academy. And today's topic is the world of homeopathy and integrative medicine, which I just mentioned earlier, that when we talk about integrative medicine, it doesn't mean that we are integrating with allopathic model. We are integrating with the whatever modalities that they're compatible with each other and they're compatible with the main medicine, which is homeopathy. Okay, I always try to it's not a frustration that I have. Again, is that the truth behind of a matter that everybody has to know. When I want to talk about the cancer patients that I treated and they're fully recovered, which is going to come as a case presentations today. So I have to compare the homeopathic system with allopathic system. I have no choice. Otherwise, a lot of questions left for you, and you might don't fully understand, because my perspective might be new for all of you, for especially the students that are coming from allopathic model. That's why I have to compare. This comparison, it's bringing the truth out. So it's my what you call it, something that I always say, who we are, my slogan, that we are where science meets wisdom. So science is always been around, but always proves wisdom. Okay, it's like what comes first, eggs or chicken? So the same thing. What comes first, wisdom or science? So there's no question about it that ancient wisdom is out there, right? And they didn't have science. The science came along, after. So why ancient wisdom is still running the science? So science is proving wisdom. So discover the wisdom of healing, not just the mechanics of disease. So I'm going to run you through my perspective step by step in order at the end of the conference that you listen to the cured cases of cancer by me, then there is no question. There is no question. So yes, true science proves wisdom. Wisdom leads to true science. So these are entangled. Okay. So the table of content of my talk today, it's a big, but again, it's a 30 hours course. And one of the challenges I always have is just to try to make it brief and to summarize it into just 45 minutes. It's a little bit impossible for me, but again, it's a big table of content on this course. So the very first thing that I always want to bring my perspective out is to talk about the philosophy of everything. My PhD is on philosophy of medicine. What is the concept of medicine? What is the concept of malignancy? Why medicine can help malignancy? These are something that we have to understand, because as a homeopath, we do not focus on pathology. We treat the person as a whole and restore physiology, not pathology. So the cancer as the advanced phase of one internal disharmony, which I always talk about it. Human body has only one disease. It's only one internal disharmony with different degrees and countless manifestations of disease, which according to every individual's predisposition, tendency, lifestyle, environmental factors, nutrition, and so many others, the disease manifests in that particular being. So, but we don't have diseases, which the allopathic model names diseases. There is only one disharmony, but those that they call them diseases, they're the manifestation of disease. So as all my students know that, they all have my book that I created, Trinity of Disease. In a physical body, there is only three reasons that the body can get sick. So I'm going to walk you through all of those. The allopathic view as a contrary concept or opposite of disease is completely different than homeopathic view that it's similar to the disease. So that's why I always say it, that these two concepts they cannot coexist, and there is no way that the contrary or opposite concept can work or treat the human body at the same time when the similar concept is trying to help. So we are, as homeopaths or whoever, what the natural modalities we are in, we're not going to take a machine gun and just go to a war against the disease. We're not going to go to a war against the disease. Actually, we are gently go to the similar of the disease, and we beautifully, gently, permanently, we're going to remove it. And I'm going to walk you through the system and the perspective of homeopathy as well. So the cutting tumor, burning tissues, poisoning system, this is not our job. This is a machine guns that allopathic model will taking and go after the disease as a war. So we do not do that. We're cutting the supply. We're cutting the circulation to the tumor. We starve the tumor. We decay the tumor, and that's our job is. And we're doing it with homeopathic medicine beautifully, because the body knows what to do when it has the right mechanism. Okay, so this is my talk. I hope that I can cover some part of it, and if not, then I have 3 presentations. I can, postpone it to the other slot I have. Homeopathy does not treat pathology. That's why the name of the pathology is not helping us. Is not, it just resonates with people that they say, I am diabetes, I have, I have cancer, I have this. But generally speaking, the disease is only one. The only thing in homeopathy is what's the phases of disease the person is. For example, the disease starts from the phase benign, the benign phase such as runny nose or fever. Okay, if it's suppressed throughout your life, the same disharmony, it evolves and evolves and evolves. It goes much deeper, and all of a sudden it can manifest in a very destructive way, with such as cancer. Okay, so the body talks to us. Body has a communication system, has a communication pathways, has a messaging system, messaging pathways, and every single body organs, tissues, system, they're working in collaborations and communications together. There is no separations of any organs in the body the way that allopathic models see it. We are not mechanics of any organs in the body. We have the holistic approach based on the law of holism that the human body is based on. So pathology for us is just a name, and we might take the name, but we don't consider it. Homeopathy restores physiology, restores the wholeness of the system, because, as I say, homeopaths are not mechanics. We don't fix organs or tissues just alone. We fix the person. We treat the person, not the disease. Disease can be any name, can be 1,000 different names on a disease, but we treat the person who has the disease. So we don't treat cancer. We don't. We treat the person who has cancer. We treat that body that created that disharmony to that level, advanced level. So our job is to bring the body into balance, harmony, homeostasis, and equilibrium, which all is about to restoring physiology. So at this point, the patient comes to me with any name. I have to take the person's case that sometimes takes 3 hours in order to understand the patient, because I have to match the person's totality of symptoms, physical, mental, emotional, and non-physical aspect of that being, in order to find the closest and the best suited medicine for that particular person. We treat the person with disharmony. We do not care about the name of pathology. Dr. Alzheimer put his name on Alzheimer's disease. Dr. Hodgkins put his name on the disease. Any doctors can put their name on the disease, but what's the solution? I can name myself on thousands of diseases, but do you care about that? What's your solution? What's my solution? Okay, so let's get into this time I am comparing homeopathic perspective on cancer with allopathic perspective, because the war around the world is the war between homeopathy and allopathy right now. It became the first and mainstream medicine because the medicine is monopolized for the past 125 years. Still, with that monopolization, homeopathic medicine is the second largest system of medicine around the world. But the academies and with effort of you is to bring it to become the first. Because the truth is behind this perspective. Homeopathic view on cancer. In homeopathy, cancer is not something that a person gets, rather something the body creates as a part of a deeper internal imbalance. Cancer cells can be seen as the body's lawbreakers. I call them a criminal, a bunch of criminals, that you make your house, biological house, completely available for them to come and break the law of your biology. I like to use an analogy because I always try to make a model to make it easier for my students to understand it, how cancer resembles. They resemble criminals within a society. If there are only a few isolated offenders, their actions may not greatly disturb the system and physiology. At this present moment when I'm talking to you, I may have some cancer cells which are trying to find a place to be hosted, to be fed, and to do the destructive job. But we have intelligent system that would understand these are a bunch of criminals, and they mark them and they send them to death. But when these lawbreakers multiply and organize, they can rebel against the body's natural laws. They can rebel the body's natural laws, healing power, and blocking all the pathways, disturbing messaging system, and leading to disorders, destruction, disease, and eventually death. They are blocking your natural physiology. They're blocking your natural pathways. So the body knows who is self, who is not self. But what's the problem here? That we let these criminals, these lawbreakers, to take over our biological properties. What's happening? It's the time the body lost its intelligence. Then these are not smart cells. These are a bunch of criminals. But the problem is that the body is losing intelligence and wisdom by so long time suppression. From the time of conceiving embryonic, infancy on. It goes back to the long time back. So human body is relying and alive on collaborations and communication and harmonious physiology. If anybody comes and interrupt this work of the body, interrupts the collaborations of the organs, tissue system, and it's affecting the harmonious physiology, disease takes place. Disease takes place, but it manifests in a different forms and a different phases. Oops, sorry. Where were I? Let's go back. Okay. So cancer cells are not external invader. These are internal creation that are made of your own cells that have lost their natural order of division, duplications, harmony, and physiology. You are all doctors, you know all this, that the cells, every single cell is going through, according to their program, according to the genetic informations and imprint, they go through a division, duplications at all times, and every single cells, it depends on the organs, tissues, and system, they have their own renewal cycle, and they have their own order of division. The order of division in pancreas is different than the order of division of liver, and liver is different than lungs. Lungs is different than skin. They all have their own genetic codes, their genetic informations. So, and according to that program, they do the job. But when that internal creation happened in cancer, They lose the order. They lose the order. They lose the informations. That's why any lawbreaker can come and feed on that cells that they lost order. So in fighting this kind of problem aggressively through allopathic model by cutting, burning, poisoning means waging war against yourself, because this is the creation. This is the body's creation. If you're putting the body through removing the tumor, or even removing the organs and burning it through radiation and poisoning it through chemotherapy, it's a war against yourself. It's simple. And the disease doesn't go anywhere. Disease is gonna go actually much, much more deeper, and is gonna find another way to attack you. These are misguided cells, are like internal lawbreakers who have taken over your biological property. You have to kick them out. You have to remove them. But how? By going and taking a machine gun against them and creating a war? Absolutely not. Even you kill them, they kill you. You kill them, they kill you. That's how the war is based on, killing each other. You kill them, they kill you. But if just a few of them escape, they're going to find another pathways and to create another way, but tenfold. That's why metastasis happened. Metastasis happened because it's almost more than 90% of people with chemotherapy happens because you created a war against a bunch of lawbreakers that they are kind of with their claws, because cancer in Latin word is, or carcinos, is a crab. It means crabs. Crabs has like claws, you know. They're like the cells that they have claws, that they're going to invade your, surroundings, and they kind of stick with surroundings, and you're trying to kill them with chemotherapy. And these cells are misguided cells. So the only thing that we have to do, bring the intelligence and wisdom of the body back to tell the cells, hey, you're not part of me, and I'm going to do something about you. So homeopathy has the best system to do that, which I'm going to walk you through. When you try to attack them by blocking their path through surgery, radiation, and toxic artificial drugs, they often find new ways to survive and spread even more viciously. This entire process takes place within your body's own ecosystem. You're going against your own ecosystem. How can you fight an enemy that is part of your own body? By continuously suppressing symptoms, which is your body's language, your body's natural expressions, communication of imbalance. So when the body is getting into disharmony and the internal physiology is out of balance, we'll talk to you through runny nose, through fever, through rash, through diarrhea. So these are the very benign phases in the beginning. Okay, it asks you to just try to support me, not to suppress me. Support me. Support my vital force. Support my immunity. Support my cell. Don't suppress me. It's my language. I'm communicating with you. But unfortunately, in allopathic model, the very first thing is anti-fever, is anti-this, is anti-that. And then the same benign symptoms is going to evolve. In everybody, is going to evolve and goes to the more advanced. So the way that it is talking is sometimes is talking to you very gently through fever. Then it's going to talk to you a little bit louder when it becomes chronic. Then it becomes louder and louder, and there's weeping and crying through autoimmunity. And then the body goes quiet. Cancer. The body goes quiet in cancer. No communications. This is danger coming to your body. When you suppressing the communications in different phases, and then becomes cancer, then quiet, then the lawbreakers, which are these criminal cells, is going to take your property. Suppressing symptoms is against the natural laws, is against the healing principles, is the deviation of healing principles, and is a violation of the natural laws. Modern society has witnessed a rise in chronic and complex diseases, largely due to a long-term dependence on synthetic drugs, on natural living habits, and unhealthy lifestyles. So over time, the use of invasive treatments and suppressive synthetic medication has contributed to the evolution of more complex forms of disease since the several past decades. We have witnessed it. The world never had this much sick people. Never. Mentally, emotionally, physically. Patients deserve healthcare that maintain health, not butchering. Healthcare to me is like a butcher shop. Butchering. Cutting, burning, poisoning is not healthcare. Patients deserve a system, a healthy protocol to restore their health. So they deserve the healthcare that maintain health, not butchering and dependency protocols that only maintain the profitable system. So this is my frustrations that sometimes I have to say it, but this is a failed methodology, and we are here to prove it that is a failed methodology. So the mainstream says you should fight against cancer. How could you fight against an enemy that is part of you? It's a waging a war against yourself. You cannot find a part of you that has turned against you. When the body turns against you, the only time the body turns against you is when it's losing its wisdom and intelligence. The same as suicide, that the body lost, intelligence. So the same as cancer. You have to gently remove it by a right mechanism. You have to be gentle with your body, especially in very advanced phase of disease in cancer. You see the two different perspectives. Taking a machine gun and create a war against the lawbreakers, or gently try to remove them by a right mechanism. You're fighting against a bunch of internal offenders who took over your, as I said, properties. And if you try to block something by cutting, burning, poisoning, it will find another road to attack you. More and more complex diseases created as are treated by suppressive synthetic drugs versus natural disease. Homeopathy is a system of medicine that works the best, fast, quick when natural disease exists. It doesn't work quick, fast when the natural disease is converted to complex disease. That's a problem. So I will walk you through that, when homeopathy can work, when homeopathy cannot work. The conclusion: cancer is not a disease itself. It's a manifestation of a long-term underlying imbalance and disharmony. We do not treat cancer. We treat the person who has cancer, and we restore physiology as naturally programmed. In homeopathy, we do not fight the disease through a contrary or opposite principles or anti-disease. We do not take a machine gun like allopathic drugs and go on a war with the disease, but rather remove it through a principles of similarities, like cures like. Homeopathy works as a rewinding mechanism, which bringing back the advanced phase of disease to benign. That's our job. The disease is in advanced phase. Your job is to rewind it, turn the clock back, bring the manifestation of disease from very malignant phase to very benign phase. This is your job. Bringing it back from the advanced to the benign. And then eventually your wisdom is going to eliminate it. the entire disease, not merely its manifestations. So I'd like to just, again, my brief overview of my perspective. So homeopathic medicine, in contrast to allopathy, works gently to remove the disease. We work with the body's innate healing wisdom, cutting off the energetic and nutritional supply to the tumor or to the any lawbreakers that sustains cancer cells, gradually starving and neutralizing them. It might sound a little bit good to be true, but it is true because I'm gonna share the cases with you. We facilitate the natural decay of the tumor from its center outward, stimulate and strengthen the immune system, enhancing the body's defense mechanism, restore internal homeostasis and balance among vital forces that are running throughout our body. We reawaken internal biological communication pathways, and we regulate endocrine and metabolic functions, helping the body return to homeostasis and equilibrium. That's all we have to do. Nothing else the body needs. It doesn't matter what phase of disease. The phase of disease that goes to the advanced phase of disease is going to be much harder and sometimes longer, but there is always and always, with the right rewinding mechanism, you can bring it back to the benign phase. And the benign phase is the time that the wisdom is kicking in. So as its foundation, homeopathy is the most scientific discipline that nature has ever revealed to humankind. And it's an intelligent system of medicine rooted in natural laws, healing principle, resonance, and the profound intelligence of life itself. So intelligent body, because we are intelligent, has to run our life. Only system that can fix that problem in intelligent body is the intelligent system of medicine. I would like to always talk about the quote from Persian ancient philosopher, which I grew up with it, Avicenna. Never cut a tumor, it becomes wild and will spread and attack you tenfold. Who said this? Avicenna, 3,000 years ago. And look at the ancient philosophers, they knew it, that you're not supposed to cut the community of lawbreakers that they have ganging up against you. Don't touch them. The moment you touch them, even one of them awaits from you, is gonna go and create a bigger community in your biological body. So always through science proves ancient philosophy. So again, goes back to the the concepts. Allopathic concepts is the opposite concept and versus similar concept of homeopathy. But we both have different philosophy. We both have different diagnostic tools. We both have different treatments strategies. That's why they don't coexist. Especially in cancer patients, don't coexist, okay? So I have cancer patients right now, two of them that they're, I would share the case with them. Both of them are on chemotherapy and one of them I just took her off in 3 weeks. She's without chemotherapy since August, and she's doing amazing. Okay, the major difference.
Excuse me, ma'am, do you continue? Our speaker is now in our.
Okay, I have to finish now. I'm sorry. Yeah, I can. So the major difference between allopathic and homeopathic approach on cancer lies primarily in their philosophical foundations, diagnostic approaches, treatment strategies. And there are some aspects of scientific aspects of, allopathic model that we agree. So the cancer is a disease caused by uncontrolled and abnormal growth of cells that can invade and spread any part of the body, for sure. and they go through hyperplasia, dysplasia, and through the differentiation that it becomes a tumor. These are something that we know, okay? And their core belief is genetic mutation, environmental toxins, infection, and the rest, which we agree. They have different diagnostic tools, and they have they go through blood tests for tumor markers. But homeopaths don't do that, do not have that. Okay, so 3,000 years ago, cancer, these lawbreakers have always been from the beginning of life. These are not just new, you know, everything was been from the beginning. Only the complex diseases created with the last 125 years, you know. Natural diseases have always been, you know. And allopathic view on cancer is a localized disease. They see it as a localized disease. They think that if they remove the tumor, burn the tissues, and poison the body, they can remove the disease because it's localized. We don't have localized disease. This is a manifestation of the systemic disease, systemic disharmony that comes to talk to you in one location. So that's a difference. It's a huge difference. A localized disease, it's a completely different than systemic disease. So again, they go after with the surgery, they go with the chemotherapy, radiation therapy, immunotherapy, targeted therapy drugs, all those things. And through everything, they're killing the natural killer cells, they're killing the healthy tissues. And then after that, actually, they put the person on steroids because they killed the immunity. Okay, so I have the patients, currently patient, I can share the case with you. That's what they have done to this innocent human being. So can any of the above allopathic approaches remove the disease in entire form? Their philosophy focusing on physical pathology and treating the tumor directly and individually. They work on evidence-based science, relying just on clinical trials and scientific research on the clinical trials. This is completely different than our approach. Our philosophy is different. It's a wholeness philosophy, and also is the patient-based science and clinical trials. Okay, let me see. Homeopathic definition of cancer is the manifestation of a deep-seated imbalance, disturbance in the body's vital force, and an imbalance in the whole person, including physical body, mind, emotion, and non-physical body. The core belief, approach, and cause of homeopathy is suppressed physical symptoms from conceiving time, from embryonic time, from infancy, from childhood, from adulthood. Goes back to very first time that the human being is being conceived. You see that how deep we can go? So suppressed physical symptoms, emotions, traumas, longer-standing stress, miasms, which is the predisposition, and genetic components, chronic disease, and weakened immunity. These are something that we take into considerations. We do in the diagnosis, we don't have the diagnosis that they do, and we may consider conventional diagnosis from the past 100 years, but we have holistic devices as well, and according to the totality of symptoms of the person, we understand the level of disharmony. We don't have to understand that, you know, the way that they do, but the level of disharmony, it's telling us how deep the disease is in that person. So homeopathy generally is I call it liberations. You're liberating the body from disharmony and healing. Allopathic is all about compliance and dependency. You have to comply. The body has to comply to this drug, to that drug, to this intervention, to that, and bringing the body into dependency, sometimes for life. So healing in any human body is not uniformity, is an individual. So is cancer. You want to treat a cancer patient, you have to treat it individually. Not the same cutting, burning, poisoning for everybody. The same prescription fits all. We don't have this in any medicine, in any health platform. This is completely against the healing principles, is against the laws of nature, that the human body is absolutely part of it and follows it. This is a deviation and violation. Deviation of healing from the laws of nature and violation of healing principles of human body. You're already killing that human. So homeopathic approach, treatment goals, restore balance and repair the vital force. And the vital force is, I can say, is like a balloon. It's like a balloon. Okay, any disease agent, anything, lawbreakers can poke it. And sometimes the poking is not that hard. It's not rupturing the vital force. It's still repairable. But sometimes it's so, that poke, that disease agent is so hard, it's going to rupture the vital force, and then the complete energy of your being is leaking out. When that happens, we have to, the only thing homeopath's job is to repair that balloon, to bring the vital force back to function. So we stimulate the body's natural healing ability and address the root causes of disease. So the main treatment of homeopathy is a constitutional homeopathic medicine based on the totality of symptoms. One thing that I would like to talk is that the majority of cancer patients that they have been coming to me, they have done something in allopathic model. Either they cut the tumor, either they had to go through a chemotherapy, radiation, or whatever. And some of them, they just did surgery. They didn't go on chemotherapy. Some of them, they did only chemotherapy. They didn't go to radiation. But there are some cases that they do not want to do anything with allopathic system. They come to me. So I have a case that she didn't do anything, and she came to me for the treatments from the beginning. No treatments whatsoever prior to that. And the other cases that they are currently, they have done different things. Okay, but for any case, we have solution. Homeopathy has solution for any case. Okay, because it's not that homeopathy has the solution, the body has solution. The only thing that you have to guide it. It's a misguided body, misguided cells. You have to bring it back to homeostasis, equilibrium, and a guided body. So we work on individualization. Not one medicine fits all cases. Not uniformity in any disease, or especially in advanced case of disease. Cases vary from person to person, so is the selected medicine, no matter general terminology of cancer. So if the person comes to me that they didn't go for the test, blood test, or any allopathic test, but they're not doing well, and they come to me, according to the individualization and totality of symptoms, I understand that the level of disharmony, and I know that whatever it's happened in the body, it has evolved into a very advanced phase. I might not know that the tumor is the same symptoms as diarrhea, right? But it's very malignant and can kill the person faster. So, but again, my job is to rewind it, no matter what it is. So there are a lot of different things that we have to do in order to bring restore the physiology, and cleanse and support the pathways, and bring the communication back. Let me tell you something that happened to one of my cancer patients. That she came to me, that was almost 5 years ago. she came to me and she said she had cancer, and she had, they told her she has 2 tumors and whatsoever. So, and I took her case and I said, okay, when did you get, when did you get, when I take the case, I understand the level of suppression and the level of disharmony. The level of suppression in that particular person was to the point that I felt that how she's walking, and she didn't want to go through the invasive treatment or chemotherapy or whatever. I started treating her. The only thing that I told her, I said, whenever you feel getting fever or runny nose or diarrhea or rash or pain or swelling or whatever, give me a call. Because for 5 years, she did not have any form of cold, flu, or fever, or any symptoms. She was asymptomatic. Cancer patients do not have symptoms because the body's language communication is being suppressed. The body doesn't talk anymore. It's quiet. So with the rewinding mechanism of homeopathy, we bring back the body from the quiet to the loud communication. For example, she came back to me in 2 weeks with the pain all over her joints. And then she started having rash, she started having fever, and her husband called me, she said, doctor, my wife for 4 years didn't have this. I said, that's bingo. Her intelligence and immunity is kicking in. So at this point, I'm going to tell you that what the rewinding mechanism does to the cancer patients. So we have a lot of different medicine in the homeopathic domain, such as no-sots, such as gemotherapy, such as tissue salts, homotoxicology, and also constitutional medicine that do work amazing with cancer patients. So these are the same thing. The philosophy of homeopathy is completely different than philosophy of allopathy. That's why, again, I'm saying that they don't coexist, okay? And I personally, for almost 27 years, I didn't even take a painkiller. I don't know if I have a kind of health card in Canada because I never have a trip to any, healthcare system. So the reason is I know homeopathy has everything for everybody. So the philosophy of homeopathy is focused on holistic healing, not a local manifestation such as tumor or sick organ removal. We focus on patient-centered based, treat the person as a whole, not the disease. We treat the sick, the person, not the sickness. The sickness gives us a little bit of guiding symptoms that to understand the person. If you're treating the sickness, you're treating the pathology, you're not different than allopaths. So this is a holistic methodology and is based on the law of holism. Okay, let's go. So are we going after the tumor in cancer? Or are we going after the causes of tumor, which is the internal disharmony? We don't go after the tumor. It's a violation of inner natural healing principles, the nature's law breaking. We are following the inner natural healing principles. It's a nature's law abiding. Homeopaths are law abiding practitioners. We don't law breaking. Imagine a bunch of lawbreaker cells that they are misguided cells and they're breaking the law of healing, the principles of healing within the body already. And the allopathic system, allopathic interventions are law breaking as well because they're violating the inner natural healing principles. And these two lawbreakers coming into working on one human body, it kills it. It kills it from all dimensions, physical, mental, emotional. It kills it. Two lawbreakers, one cancer cells and one allopathic interventions. That's what I said. So the union of two lawbreakers, it causes human body destruction. That person is not going to be healthy again. Never healthy again. So let's just go a little bit faster. So I told you that the cancer cells means crab. The crab has legs at, that's why it's invading the surrounding tissues, and it sticks with the tissues, and it's going to get a lot of, supplies from different tissues. So these are the lawbreakers. So cancer means crab. Okay. What do they do? What's their characteristic? What's the difference? What this means the lawbreakers cells and misguided cells do different than the natural cells? They were natural cells. They were the cells, but they completely lost information. And then when they lose information, they become chaotic. They do whatever they want to do, and they go wherever they want to go. Because these lawbreaker cells, they're ignoring signals and messaging to stop dividing. Because according to our genetic imprint, so the cells of pancreas, they're going to go dividing, duplicating, and whatever, and then they get a message of the body that stop dividing. And they have to stop. These cells, they do not listen. Because first, that internal disharmony, it's already blocked the messaging system. They already blocked the pathways communications. That's why there is no messaging going and coming in the body. That's why that cancer patients did not get any fever for 5 years. There's no messaging system. There's no messaging system for immunity. So these cells ignoring signals to stop dividing. They keep dividing. And they do not go under normal dead cells apoptosis, which is a very normal thing that happens almost all the time by immune system. And they invade nearby tissues by their claws, and they can spread or metastasis to distant body, anywhere in the body, throughout blood and lymphatic system. These are creepy cells. And these creepy cells are the creation of the same body that lost wisdom. Now, homeopathy has to bring the wisdom back to that body to remove these lawbreakers. These cells, as I said, the normal cells, they stop dividing when they get the message, but the cancer cells already blocked the messaging system. They don't get. And they evade from the immune system as well. They don't listen to immune system. They escape. And they say, are they smart cells? To me, no, they're not smart cells. They're criminal cells. So the normal cells are behaving normally according to the imprint and informations of the program for. These are completely misbehaving abnormally. So are you going with the machine guns after the misbehave abnormal cells? They can spread. They can go with different places, and they can affect you, and they can kill you actually much faster. So again, homeopathy goes with restoring physiology. We do not work on pathology. These are two distinct concepts in treating cancer. So the reason that I brought it up, because I want you to be much familiar with my perspective, how I can treat cancers, because I teach cancer courses to medical doctors, that how they can treat their patients with homeopathy and integrative medicine. So that's why I have to bring it, into kind of presentations to really understand how it works. So, okay, let's go to the rest of the things. So the cancer cells, the difference is that they don't receive the signals, they don't communicate, they completely block everything, they escape from the immune system, and natural killer cells cannot find them, they're hiding, and that's how they do it. It's the same as criminals that they're going to break into your house. They always try to hide from you. They always try to come from a corner that you cannot see them. They always come, they want to come in a dark that nobody sees them. That's how the lawbreakers are. You know, if the main door is closed, they try to find the back door. If the back door is closed, they try to come in through the windows. They always try to get in from different ways, and they always know where to go. And that's how, you know, the cancerous cells are. So they are completely taking over the biological property of the body, but they manipulate everything. They manipulate your metabolism, they manipulate your nutrition pathways, because the cancerous cells are so hungry, they have claws, they become they gang, they are a gang, they're ganging up against you, and they're a community. And the cancer cells eat 30 times more than normal cells. 30 times. That's why anybody who comes to me for any form of, conditions, I ask them to go on fasting, because fasting is the first thing that I do with the cancer patients to cut off some supplies for in the beginning, because they eat 30 times more than normal cells. They love and thrive on sugar. They have 10 times more sugar receptors because they have claws. Okay. So, and they have more blood vessels via angiogenesis. They manipulate everything. And because they become a community, they're a gang, a huge gang, they create, they try to protect themselves, and they create a process of angiogenesis. Actually, they make the blood vessels on their own. It's like they make their different highways for themselves. That's how they do it in the body. So, but again, homeopathy has answer by correcting the gene expressions, bringing the body into homeostasis and regulations by rewinding mechanisms. Okay, so what homeopathy does is gene regulations, balancing homeostasis through nanostructuring and water signaling, through biofield interactions, through epigenetic modulations, through modulating histone acetylations, and influencing microRNA expression. This is something that I teach it in the course, but I'm just mentioning it here. So all these regulations happen within the cells. So when it goes back to the allopathic things, so I want one cancer patient that she's currently under my care, and I would like to tell you that there are times that the person they say is cancer, but is not, which I'm going to explain to you. One of these cancer cases that currently is under my care. I am not convinced that was cancer. What did that happen? Sometimes inflammation and infection is changing the morphology of the cells in the PET scans, for example, that they're relying on, and they call it cancer. Okay, they have a limitation, and sometimes some conditions such as inflammation and infection can mimicking cancer, which is not cancer. Okay. So cancer cells and starvation, what we do, we have to do it with homeopathic medicine, and we had to cut off this angiogenesis that is done by cancerous cells, and homeopathic medicine does it beautifully. And cancer cells hijacking the pathways, hijacking metabolism. So reprogramming metabolism to their benefits and promoting blood vessels through angiogenesis. This is so unbelievable how they can do it. But I still don't call them smart cells. I call them criminal cells. They do for their survival. They do anything for their survival. If there is no sugar in their body, because they thrive and live on sugar, they go to lipids, they go to fats, and they reprogram metabolism. If there is no lipid, they go to amino acids, to proteins. They try to feed on that. This is something that very, very highly, as I say, criminal inside the body. Okay, so now you know that what they do, they hijack everything. They hijack your communication pathways. They hijack your messaging pathways. They hijack your metabolism. They hijack your nutrients pathways. And then they leave you to die. So they are highly adaptable. Cancer cells can switch from sugar feeding to other nutrients such as fat and proteins. When any pathway is blocked, they go to another pathway. What happens? It's when the physiology out of whack, when the endocrine, pathways is not running based on the programmed physiology. That's what they do. It's a chaos. It's a war. It's called internal war. Okay, and that's why treatment should be holistic approach by attacking metabolically, genetically, immunologically, and energetically, which we can do it with homeopathic medicine. Cancer cell evades immune system. Yeah, our defense system, our bodyguard, and they evade it. The immune system cannot go. It's like they go through the blind spot of immune system. So what happens to the intelligence of the defense mechanism, defense system? It's sleeping, it's inactive. That's all. Okay. I think I talked, so let's get into the evolution disease table. This gives you all the information that I talked about. Just this table, enough to know. I give it to all my students. Just this. Disease is this: from excretion, inflammation, deposition, impregnation, degeneration, dedifferentiation. As you see, the dedifferentiation, which is cancer, is the last phase of disease. The last phase of disease is the time that the body is quiet, is asymptomatic, doesn't have symptoms. It goes to the quiet, state. But with excretion, there is something, either diarrhea or runny nose or something. With inflammation, there is always swelling, a fever, pain. So see that the benign phases? When the benign phases are suppressed, they go to the very last phase of the cancer. Cancer is the result of long-term suppression. Okay? So we're removing the disease homeopathically when permanently. So homeopathy, if you do it right, correct, you're removing the disease permanently. It's a choice of the doctors how you want to do it, and it's a choice for the patient how you want to do it. Okay, so again, I like this one, that the body talks to you through symptoms. The benign phase communicate with you gently. In chronic phase, communicate louder. Advanced phase, crying out, such as our autoimmunity. And in a malignant phase, goes quiet. Oh, it's very creepy. Okay, everything that happens in our body starts from the cell. Disease starts at the cellular level. Health restores at the cellular level. We have to work at the cells. We don't have functional disease. Functional disease is the result of cellular disease. The only system of medicine that is a cellular disease is homeopathy. The rest are functional, such as medicinal plants, such as herbology, such as functional medicine, or even nutritional medicine. They're all working at the functional level. We don't have functional disharmony. Function of the body or physiology is the result of cellular sickness. So this is my trinity that I have it in my book, and I think all my students have it. So we have to address this. We have to address the deficiency of the cells. We have to address the cellular intoxication, and we have to address the powerhouse of the cells, the mitochondria, that bring us adequate energy flow. Okay. The biochemistry of body. Let's get to the physical body. That is, for example, 92 essential nutrients is filling up the vessels of the physical body, and 60 of them minerals, 16 are vitamins, 12 are amino acids, 2 or 3 are essential fatty acids. The rest is water and oxygen. As you see from the numbers of the essential nutrients, 2/3 of the essential nutrients are minerals. Minerals are very crucial in your health, is very crucial in your homeostasis, very crucial in your pH balance, and is very crucial in restoring physiology. And when you get, I don't have time to get into the details because it's the course, right? But the chromosome or DNA, if there is mineral deficiencies, can mutate, and mutation of the DNA can cause any problems. So that's why we have to pay attention to the deficiency before we get sick, right? Okay, so okay, I think I have to finish it by here. Okay, what I like to say is that when the body gets a message of deficiency, the check engine light in the cells starts flashing. Intelligence of the body knows something is going wrong, and it will create symptoms. So anything that goes wrong in the body, your intelligence is creating symptoms. It's the language of your intelligence. Symptoms such as tumor are your defense and survival mechanism. Cutting it, burning it, poisoning it, it's going to a war against you.
Ben ini ya.
So tumor is your survival symptoms. Me, as a practitioner, if I personally, I don't touch it. If it happens to me, I don't touch it. So because it's actually survival symptoms. So the same as fever, the same as diarrhea. In a benign phase, this is in a differentiation phase. So still is your survival. Don't cut it. Starve it to death. Gently starve it to death. What you can do it, I will take you there. How you can do it? By cutting, burning, poisoning the tumor, the manifestation of disease, you are doing nothing to cure, but harming with more destruction to the body as a whole. By cutting, burning, and poisoning a tumor, you're just removing the manifestation of disease, which is your ultimate survival. By cutting, burning, poisoning the disease would remain untouched, uncured, uncontrolled, and never removed. And it goes deeper and deeper, and eventually it's going to come back tenfold. Again, by cutting, burning, poisoning, the disease will remain deeper within the body for a lifetime and manifest in different ways. So when certain kind of disturbances occur in the body, either because of deficiency, toxicity, or person's attitude, food, lifestyle, genetic, or any other factors due to which the energy body gets affected. The energy body is a vital force that is running the physiology. An atmosphere conducive to the growth of cancer cells is created. If the flow of energy is not good in a certain part of the body, cancerous cells choose that place to hide and fester. In the world of holism, we do not look at cancer as different types. Breast cancer, kidney cancer, this cancer. The person has cancer. The entire being is being affected. Where and how it manifests in a particular individual may depend on various aspects of individual physiology, genetics, lifestyle, diet, and other factors. So we always see the root cause as an imbalance, which is the disharmony in the entire dynamic body. So we treat the person, not the disease. We treat the sick, not the sickness. This is the homeopathic views. Thank you so much for listening to my perspective on cancer. But the next presentations, I'm going to share with you my cancer patients, the ones that they're fully cured, fully recovered, and also the ones that are currently under my care, and because they're very interesting cases to know. So, and thank you so much for being part of the Bioquantum Academy and part of this 5th International Conference. Thank you, and I'm open to any questions.
Yes, ma'am. Thank you. Thank you so much for your wonderful speech. And we understand that cancer is spreading and how we will treat. Actually, you easily say that we don't treat the cancer, we treat the disease of vital force. And you said about how cancer is spread and what is the difference between allopathic treatment and homeopathy. And today's discussion topic is really wonderful, and there are some questions. Do you take question? In chat box, there are some questions.
Mm-hmm. Okay.
Yeah.
Can you read the questions? Okay, let me just read the questions myself.
Miss Ellen, do cancer cells behave like parasites? Is cancer a parasitic disease?
Do cancer cells behave like parasites? Is cancer parasite? No. No, cancer cells are misguided cells who lost information, who lost genetic information, and I just said that, I just said it through my, presentation, and they do not respond to any signaling messaging of the body because all the messaging system, pathways are blocked, and because of the internal disharmony. So these are the same cells, the same natural cells that they go through mutations, and they misbehave, and they are misbehave, and they don't go according to the genetic informations. They're not parasites or something. No, that's not. So you say never cut a tumor, it becomes wild and will spread and attacks you tenfold. But what happens is the many treatments are done by cutting tumors, and the result, the improvement is just temporary. The disease stays untouched. When you cut, burn, and poison the body, the disease stays quiet. And you be careful, because you think that is improvement is a very temporary adjustment, temporary managing, but the disease is going to go actually much quieter and is going to attack you. And so that's the truth behind the allopathic model, that they think it happens. First of all, the cancer patients that are under my care, none of them improved so far. And I can share the cancer cases with you. None of them improved. But the improvement that they say, the reason is that you think that is improved because the body's shut up. It doesn't manifest the disease anymore for a while. You just shut it up. And okay, so let me just.
There is another question.
Yeah, okay, go ahead.
Dr. Christina, he said about, Professor, you say never cut a tumor, it becomes wild and spread and attack you tenfold. But what happens is the many treatments are done by cutting tumors and the result improve. Philosophy focuses on holistic healing, not local manifestations such as tumor or sick organ removal. Is it possible to recover if the tumor is not cut out? And another.
Okay. That's my perspective, and I have treated cancer patients for the past decades. So, and this is the philosophy of homeopathy and holistic. that do not touch the manifestation of disease. Doesn't matter, it's a rash or it's a tumor. All of them are your survival, okay? You just have to have, remove the disease, the internal disharmony by the right mechanism. Cutting, burning, poisoning the body, you're creating a war against yourself. You're creating a war against your biological properties that is being taken over by lawbreakers. And these lawbreakers are a good sign that they are coming, they're ganging up as a community, and they come in one place. Instead of going everywhere, at least they come in one place. And you're going and you touch them, you cut them. It's even one cell is going to escape. The body's done. The body's done. Because they're gonna come back, attack you tenfold in a different, from different angle. So the improvement, I don't know what questions from which doctor was. The Dr. Christina, I guess. The improvement, Dr. Christina, that's not improvement. That is the blocking the communication and quieting the body that not to communicate. And that at that time is not improvement, it's just the body goes to deeper quieting. That's not improvement. And you as a doctor, you will see that that patient's gonna come back with the tenfold problems. And so when the body is quiet, doesn't mean that the body is healthy. The body has to talk. The body has to communicate. The body has to keep sending signals. If you're blocking that pathways, which these lawbreakers do, the cancerous cells do, you think that and actually one of the patients that I told you that 5 years ago, she came to me and with tumors, and she said, I am healthy because it's been 5 years that I didn't have cold and flu and fever. I said, okay, when you get a fever, please call me, because that's a problem. The body needs communications. We are a living being. The living being needs, to communicate in a different ways. Sometimes in form of pain, sometimes in form of rash, diarrhea, fever, this, that, the body communicates. In cancer patients, the majority of cancer patients that they have been through a suppressive method, the communication is completely blocked. They don't get symptoms. It's asymptomatic. That's a danger. That's very dangerous. So, Dr. Christina, that's not improvement. That's the lack of communications of the body with the rest.
So in chat box, there are some comments, and you can check it. You can give answer now or in last of the program.
Okay, let me just go to the check. Okay, there are two. Okay. Thank you so much, Dr. Suri. Dr. Suri, she's an oncologist as well. So she says, amazing presentation. It's so true. Yes. And this presentation is what I am waiting for from you too. Thank you so much. Dr. Suri, I know that you're working in oncology department, and amazing job you're doing. But as I mentioned to you before, you should take the course, the full course, okay? Because you're the one that you should, convert this system, this oncology system, to the true system of medicine. And I'm proud of you, honestly. And yeah, I know in 2026 you're going to come and take the course. So if someone gets a tumor taken out, is there no such thing as remission of cancer? Is there no such thing? Actually, there is no remission. When you're cutting the tumor, when you're cutting the manifestation of disease, there is no remission. It's going to come back. It's going to come back. It's going to come back in a different form. So, and this harmony doesn't mean that if you're cutting the tumor, another tumor comes. It comes in a different form. This harmony is something that we don't know what the individual is going to respond to that disharmony. Maybe it's going to be very hardcore autoimmunity, because cancer is the immunity related. So we don't know if you cut it. Maybe the autoimmune, lifetime autoimmunity can cause, and the person is going to be crippled. So there is no remission. Everything that is happening in allopathic model with cutting, burning, poisoning is temporary. It's just temporary. The body is going to respond in a different way to this internal war, because you took a machine gun against the disharmony. It's going to come back. So, but I'm not saying it's going to come back as a tumor. It's going to come back as a different disharmony. Because don't think that you're removing the tumor, you restored physiology and homeostasis. You're actually deepening the disharmony much further. This is very scary. Dr. Seri, she's oncologist as well. She knows what I'm talking about because she has been witnessing the cancer patients. So, and again, I think you guys, when you listen to my, presentation, case presentation, it's going to answer some of more questions. But I would love to answer more questions if you have. Yes, yes, Heather. It's it's very scary that what they do to a living being by cutting. I have a patient that not only they cut the tumor, they cut the organs. So it's not a healthcare, it's a butcher shop. So and they're butchering people's organs, and this is not restoration of health. This is not. And again, tumor, no difference than a runny nose. The runny nose is benign, doesn't kill you. It's a benign phase of disease, but the same runny nose is suppressed. It's goes further and further and deeper and further, and comes manifest as a tumor. The same runny nose that is your survival mechanism, is a communication form of your intelligence. The same thing as tumor. Tumor is the communication of your intelligence. It's telling me that this harmony within you is so bad, it's so big, it's so long. You got to do something about it. Okay, in homeopathy, we don't take the machine gun goes against them. We rewind it. We turn the clock back. We turn the clock back. We turn the disease back. We don't go further. This is not the natural laws. This is not the healing principle to go further without a tumor, without an organ. No, we have to bring the body back to the when he got sick, but was benign. That's our job. That's our job. Disease has to go back, not to go further. Allopathic model takes the disease further. We take the disease backward. That's the way that healing principles are. They violate the natural healing principles. We abide, we follow the natural healing principles. That's the only way. Disease has to go back to the time that was benign and then restore health. When it's benign, restoration of health is immediate. Homeopathy is a rewinding mechanism. It's not taking the body further. It's taking the body back to the time that the body was harmonious. The body was in equilibrium. The body was in homeostasis. So that's what we do. Okay. And you as doctors, please take it into consideration. The way Dr. Seri did, the way that Dr. Seri is doing. Dr. Seri, would you like to say how long you have been working in oncology?
Thank you, Professor Sarin. Nice to meet you again.
Thank you.
I am not in oncologist for chemotherapy, but I'm in a palliative care for treatment the quality of life of the cancer patient. So I saw a lot of patients who already did all the chemotherapy, all the radiation and so on, but they become worse. Even my senior, some doctors, after chemotherapy 5 times for the hepatoma, for the liver cancer, 5 times, and he was gone last month, only 5 times chemotherapy. And also another for pancreas cancer, my colleagues also, my senior, 27 times chemotherapy and gone. All the body destruction, all the body after the chemotherapy. That's why even I myself, I suffer of lung cancer 3 years ago. When I go for PET CT, the PET CT showed that all my lungs full with multiple nodules, cancer, lung cancer stage 3B, because in my lymphatic, in my thyroid, and some lymphatic, there are red colors. But after my thyroid cut off, it's only benign, it's not cancer. And also when I did the cryosurgery for my one nodule, the biggest in my right lung. The professor in China confused, is it cancer or not? Because it's not like cancer, but it is cancer. And finally they found that it is sarcoma cancer, sarcoma, and cannot, not sensitive with chemotherapy, not sensitive with radiation, nor immunotherapy. That's why I was so glad.
Yes.
And myself, I have to reverse all my disease, become normal. But because I was so tired, these three months looks like it will spreading again, but I control it again.
Yes,
so
thank you so much.
This presentation today gave me a light for me that this what should I do again, disciplinedly, to make the cancer and the tumor starving, and I have to make my metabolic and all my system in the body to be in a balance again.
Yeah.
Thank you so much, Professor
Thank
Sarin.
you. Yes, I just mentioned you're working in oncology department, so that's what
Yes,
I was correct. So, yeah, thank you so much. Okay, I think it's more questions. Thank you so much, everyone. Dr. Rasul, welcome to the conference. Yes, says hold. Okay. Who is Dr. Ramesh Manian?
Hi, Prof. I'm Dr.
Hi,
Ramesh
hi.
from Malaysia.
Hello. Nice to meet you. So you want to record? You want to record next presenters?
Yeah, is that possible?
Yes, you can.
All right. Thank you.
Okay.
Thank you.
You're welcome. Okay, the holistic philosophy doesn't work on one organ; it works on multi-system. And yes. Thank you so much for your validation, Dr. Rasul. And yes, the holistic approach is an amazing, this is a law of holism, right? Okay, so I hope that my perspective, it did not annoy anybody, and it can be helpful for your future, practice, because we are here to all work based on the truth, and that truth is should not be hidden, and it should be out. And this platform is all about to bring the truth out. And thank you so much for all of you for listening to my presentation. And please join next my presentation in the afternoon, that I'm gonna share 3 cancer patients that they have been under my care. Thank you. Okay, Dr. Allah is back to you.
Okay, thank you. Is there break or next speaker may have floor?
Sorry, Dr. Kumar, you were, you were a little bit late in the conference, so I had to go for, that's why, I replaced you. Now, I apologize.
No problem.
So who is?
Wow. Thank you for everyone. Now we are participate 30% from all over the world. It's really a interesting and wonderful moment we are passing. And now our speaker, Dr. Prabhu Kumar Raju from Selangor, Malaysia, co-chairman Bioquantum Academy. We are waiting for his speech, and he will say about the role of epigenetic corrections is autoimmune disease. And I think we will be pleased, and Dr. Prabhu Kumar Raju, and I think he will explain everything. So we are waiting for his speech. Dear Prabhu Kumar Raju, how are you?
Very good evening, and I'm ready for it. I think everybody will be excited because Dr. Parveen has given a fantastic role of our human body in general with cancer. So I will be adding on a lot of things what she has already told, and I think it will be an exciting journey for all of us to listen to this particular topic called epigenetics and autoimmune. So I just go ahead and share my screen first. All right, we are all here, excited, and I am very excited. My humble apologies. Things got delayed for the reason is I have been preparing until the last moment. Just hardly half an hour ago, I finished my whole slides. It has been a long journey, and it's a beautiful journey of today on the 25th of October. And with all the beautiful souls down here who are all looking at our journey to listen to something what is called as epigenetics, which is what plays a very, very important role. And my today's presentation is something to do with autoimmune disease. And it's been an honor for me to be on this platform as a faculty member in charge for the epigenetic. I'm privileged to say humble pranams and thanks to Dr. Parveen for giving me this wonderful opportunity to share the knowledge on epigenetic in the autoimmune disease situation, which is quite rampant in today's world. So for all of you down here, it's an event to learn, collaborate, exchange, share, and uplift with the academic acumen. So I welcome you all on this beautiful platform to this sharing of information, which is going to be there for the next 2 days. And it will be exciting for you all to tickle your brain and then start learning and then joining us as a team into this beautiful world of holistic, medical field. So epigenetic correction in autoimmune disease is today's topic, and I'm privileged to present on behalf of the integrated medical practice and the Department of Epigenetics, which I am heading, and then it's a long journey. It's going to be for me a long journey, and then it's going to be a fantastic experience for every one of us, including me, because it's a journey. All the while, I've been a clinician. Now, today, I have an opportunity to become an academician, wherein I'll be sharing a lot of knowledge, and which Dr. Parveen always goes on insisting. We need to leave a legacy. Now, the legacy is knowledge. It's not the money, it's nothing else. It's just the information, knowledge, expertise which we are going to share. This is what we as a team from Bioquantum Academy are very, very excited that we want to share this beautiful knowledge to every one of you who are here. Now, saying that, I don't want to go too much into details of my own self, saying that just I will give you a glimpse of what I am. Basically trained as an ENT surgeon, and then later on I went on to train myself in stem cell therapy, then energy medicine, and in the past 10 years I have been practicing a new field, a new dimension in the medical field called and epigenetics. And it was a beautiful journey that 2024 I accidentally came across something called Bioquantum Academy. It was an accident, and I think it was on my WhatsApp. I saw this, and then I was wondering, what is this Bioquantum Academy? Because I have been using a machine which is called as Bioquantum Bioresonance machine, and that excited me, and I sent information of who I am to the academy. And to my surprise, Dr. Pervin responded within 24 hours, and she said, this is something excited. I want to meet this doctor. And that's how it all started. And today I am here on this platform because of the grace of Dr. Parveen and the team of academicians inside the academy, which allowed to join them as a team member, as a faculty member. So my journey is almost 36 years as an allopathic doctor. So I'm privileged to just tell that I am an allopathic doctor, but when I come to epigenetics, let me be very, very frank and precise. It's a precision medicine. It's in allopathy. It's a precision medicine, but we go to the cellular level. If you had heard the what Dr. Parveen was telling, the cellular health plays a very important role, and every disease starts from your cell. This is something which is exciting. So I think I am joining hands with Dr. Parveen, and then we both are going to talk about cellular health, and that's where we can move forward. So not to go too much of into the details of what I'm doing as I go through, I would rather spend more time on what we are going to do. Now, what basically everyone need to understand is, as Dr. Parveen very clearly mentioned, that it's not just going and removing the tumor is going, you're going to do something. No, there are a lot of other things. And can you believe whatever the nutrition which we need is around 92, and out of that 60% of it is minerals, and it's all trace elements and all micronutrients. But let me tell you, in epigenetic, it plays a wonderful role, and it is very, very important that we can make a change in our life and we can become healthy. See, at the end of the day, why should you be exposed to a cancer or any other disease? As long as we can take care of our health through the cellular health, I think we all can move forward. So coming back to our integrated medical practice is nothing but a good physician treats the disease, but a great physician treats the person who has the disease. Now, when you say treat the person, it is a holistic approach we all need to look into. And every field on this planet Earth, be it your homeopathy, Ayurvedic, natural, and there are many other courses available, and they're all doing a great job. Nobody is inferior. Everybody has their own beautiful journey, and everybody has their own, I would say, a scientific approach towards our diseases or towards becoming healthy. So now what is happening is we are talking about autoimmune disease. Now, what exactly is that happening? It's your own immune system fighting with its own cells. And what you see in the mirror is it's like you're punching your own self. So here our own cells are all fighting against our own cells and tissues. Now, this is what is an autoimmune disease all about. Now, saying that, if you look at our journey of life, now, in a normal circumstances, what happens is our body immune system will recognize, attack, and destroy the invaders, be it a bacteria, fungus, virus, it can be your cancer cells, and kill them. So for that, what happens is there is something called a protein which is produced during this process. It's called an antibodies. So that's why when you see sometimes when you get a disease, after that, you get an immune system boosted up because your antibodies are produced. Now, this is where the vaccination part came in 50, 60 years ago, wherein, we were vaccinated like you and me. I think commonly we were vaccinated for measles, your BCG, all this. But those days, the way they created was that they produced natural artificial antibodies so that you're getting protected from that particular disease, like smallpox. It was eradicated. Why? Because the injections which was given as a vaccination form, and it was eradicated. Now, but today we see the situation is quite alarming and quite scary, that in spite of taking, like for example, you can look into our COVID vaccination. I've seen a lot of people after COVID vaccination, they get infected with COVID. Now, what's happening? Where is things are going wrong? So this is where we need to look at a little beyond as what we are doing. So saying that, what happens is when we look at our journey, we need to move forward and see what next has to be done. So what is that we need to do? If you just look at the geographical picture of autoimmune disease in the whole world, it's around 9.5 to 10% of the world population, which is approximately around 840 million people are affected by autoimmune disease. But to add on to this particular, the percentage, I would say that after the COVID started in 2019, after that, what has happened is, I think it has exploded exponentially. I see a lot of people suffering from autoimmune diseases. Now, why is the situation? It can be the post-COVID infection, it can be post-vaccination, whatever the reasons are, the autoimmune disease is very busy in spreading itself. So, in one way, when you see why is autoimmune disease getting upper hand in their journey. Now, this is where we need to look at epigenetics, wherein we can do a lot of things and then move forward. Now, just going back to our autoimmune diseases, what are the situation you are looking at? Now, there can be a genetic one, it can be your infections, it can be hormonal changes, it can be environmental toxins, your chronic stress, your diet and gut and imbalances, vaccination. I put this vaccination because I see a lot of cases who have been vaccinated and then their autoimmune system has been triggered and they are facing the situation of an autoimmune situation today. This is the biggest challenge for the medical fraternity, and that's where we need to see how can we help all these souls who don't know where to go. Now, if you look at autoimmune diseases by itself, I have listed almost 100 different autoimmune diseases, but I'm not going to step by step, individually show you, but just in the slide, just look into it. There are 100, diseases which is affected through the autoimmune system. So seeing that, you can see all this, almost the 100 thing is here. Now, what is happening? This is just for a general, I put this slide because the previous, I think 50 years ago, we never had an automatic vehicle, we had a manual one. But today we have automated situation, and in that today we have AI driven cars. So I think our body also is, it wants to take to the next level of, going into an auto mode. That means everything gets automatically done and then started. So this is where the disease, when you're looking at and when it is auto, to stop that particular problem is going to be a big, it's like, you just put it in the auto mode and live, it'll just go wherever it wants to. The same way, what is happening is because with the 50 trillion cells in our body, now, where is the situation starting and where is it going to end? We don't know. The cancer may start in one particular place, but it can start spreading to other parts. And as Dr. Parveen said very beautifully, just by cutting or removing the particular thing, we do not know. But one thing I can definitely tell you, the moment you cut the cancer tumor, what happens? Without your knowledge, there might be spillage of these cancer cells and they start spreading out. and they have a fantastic mechanism of just survival mode. Once they are in that survival mode, they don't bother who is in middle, who is going to, they will just rampantly start moving and spreading them, and they have a teamwork. All the cancer cells are having a very, very good teamwork. And today in this platform, if at all you and I haven't teamed up to at least come and listen to this 2 days of conference, I don't think we can change anything as universe. So our job is we need to team up and we need to work on a same, I would say, the mental frequency of understanding how do we go to normalize to the homeostasis, which is a very, very important aspect of every human being. So homeostasis plays a very, very important, and we all need to work towards that. Their epigenetic plays a very, very important role. So now what's happening is, just going back to your a little bit of history. Now, it was only in 1912, Hashimoto's thyroiditis was the first time they put it under the autoimmune disease, and that was the Japanese research scientist, Dr. Hashimoto. He picked up this particular situation. But when you go into the little development of it, everything started to open up sometime during the 1940s and 1950s. And that's when they started looking into something called autoimmune, and then everything started going into a little more detail. But today, there are a lot of research, there are a lot of people working on this autoimmune. But what is happening is, where are we heading? Because we are not able to control the autoimmune disease situation. It's just opening up and going ahead, and then we don't know what to do. And to 2025, I can definitely tell you, we are facing a biggest challenge. But I'm here and I'm privileged, I'm honored, and I'm proud to tell you that epigenetic can do a wonderful job in terms of controlling autoimmune disease. Now, why do I say that? As I progress, I'll be sharing the information. I think every one of you will be getting excited. Then you know what to do. There is a process, and I'm going to show you all that. So now what's happening is, for your immune system to work properly, your body must be optimized from all angles. Now, as Dr. Parveen said very beautifully, you need to, it's not just the moment you see cancer, it's not just you're going to go and, kill cancer or, remove cancer. It doesn't work that way. It starts with your diet. It starts with your mindset. It starts with your energy fields. It starts with your discipline. Everything plays a very, very important role. But here, what I would request and tell every one of you on this platform, honored delegates, let me tell you, take care of your health. Don't wait until a disease comes in and then you start looking for solutions. It's not easy to find a solution once you get a disease, but there is an option available for you to do something wherein what you all need to do is, this is the language I speak, is it's called optimization of your health. So here we are not talking about, you have something and then we optimize. No, optimization is a process which you need to do in and out every day. It is not just one fine day you are optimizing and then the next day you do whatever you want. It doesn't work that way. So optimization plays a very, very important role. And can you see this gentleman, with one punch, everything can be stopped. So saying that, we all need to work to, with the challenges, with the kind of environment we have, with the kind of people's mentality, with the kind of, I would say, chaotic situation on this planet Earth. What are you doing? What can we do? We all need to work on how do we optimize our health. So now, if you are going to be in an autoimmune system, it can be triggered by any factor which compromises the immune system. There are more than 100 autoimmune diseases as of today. Now, do you want things to be getting triggered, or you want to, I think Dr. Parveen said very beautifully, harmony. Harmony is something very beautiful. Harmony is something everybody wants. You want a harmonious life. You want something, harmonious with the universe. This is what we all want. But are you working towards that harmony so that you can expect harmony? But you live in disharmony, and can you expect harmony there? I say no, definitely not. So what you need to do, let's go into the next situation. So as I told you, there are 100 diseases. which are ready to come into your body, which are all called autoimmune diseases. There are 100 just now, but I can list you almost 1,000 different diseases which are available very easily, because everything is labeled there. It's all a diagnosis which is already in our allopathy. It is done. But what are you going to do? What are you going to do? The list goes on and on and on. So now, today is the time where you're going to get an information which is something slightly different, and something which will be tickling your brain for you to look into and then start working towards it. So once again, going back, it was in 1900, it all started, then 1912, then 1949, then 1960, the concept of immune tolerance came in 1960. But let me tell you very frankly, as of 2025, we still do not know how to handle an autoimmune disease. But I think Dr. Parveen will be very proud to let know that through homeopathy, probably we can do a lot of things. But along with her, I'm going to stand beside her and tell you all, through epigenetics, I'll be also working along with Dr. Parveen and telling you all proudly that we can work together. And I think we should be able to give some kind of, eye-opening situation, and which looks very simple, very easy, and we all can work and then help every patient of us or client of us to at least stop the autoimmune process and then give them a decent, healthy lifestyle. So now, epigenetic correction will be the pillar of, now this I'm going a little strong, and my conviction is very, very clear. With the epigenetic correction will be the pillar of autoimmune disease management in the future. There is no shortcut. It is going to be. That's why if you see, the hammer is your epigenetic and the disease is your base. So I'm going to hit with the epigenetic, and the disease will start opening up and says, sorry, sir, don't hit me. I'm going to go away. I'm going to balance, and I'm going to help this beautiful individual, and I'm going to heal. This is what your body is going to. So this is where epigenetic is going to be the game changer for the future. And we from the faculty of Bioquantum are here to share the knowledge and help every individual who is going to be a part of our team, a part of our student academician. We all can work together, and we need to work together. It's not that I myself or Dr. Parveen or Dr. Faisal or the team of beautiful doctors down here alone can achieve what we are looking at as a good health, a decent, I think, optimized health. We all need to work together. So let's join hands and move forward. So saying so, what are the things? This is just for an academic information only I'm sharing. I don't want to go into the details, because this and all we want to give it in the courses which we are going to give in 2026. Now, there are 4 things which happens in epigenetic. One is your DNA methylation. The second one is your histone modification. Third one is your non-coding RNAs. And the final is your chromatin remodeling. Now, this today is not the time for me to go into the detail and confuse you. What my message to you would be is how autoimmune disease can be assisted or can be addressed through epigenetic correction. So now, once again, when we are looking at our journey here, what's happening is we are all working on different stages, and there are a lot of situation which will happen the epigenetic at the cellular level, and what we need to do is, as a clinician, you want to go inside and see, it's going to be difficult, but I would prefer, let's go into the easier way of clinical assessment and how do we handle our clients, which is going to be the easiest way for us to move forward. So what's happening is, let me move to
Dear
the
sir,
second stage. All right.
dear,
Now,
dear sir,
there
we
is
are
some.
hello, dear
Hello?
sir. Sir, we are happy to hear you and say that they are waiting for next speaker.
No
So,
worries. I will just scroll through. Just give me another 5 minutes. I think I should be able to
oh
give the
yes,
right
okay,
information and move forward. Now, there are
thank you.
this particular slides. I think you all don't need to go into details, but there are some 9 epigenetic factors which play a very, very important role in our epigenetic correction. Now, saying that, but these are all something more detail. I don't need to go into the details. Now, what are these also plays a very, very important role, like your heavy metals. If you do not detoxify, definitely your autoimmune disease also will not be under control. So we need to do the heavy metal detoxification, which plays a very, very important role. Now, other than that, the key mechanism, I'm not going to go into the details. There are few stages where you need to correct it, then thereby we can actually control your autoimmune diseases. Now, parasites plays a very important role in your epigenetic correction. Some parasites will trigger, some parasites will silence your autoimmune. So here also, clearing your parasites in your intestine plays a very, very important role. So here the gut plays a very, very important role for you to correct the autoimmune diseases. So inflammation, that is another big chapter which also plays a very, very important role in your autoimmune diseases. So we need to bring down your inflammation. That's another area we need to look at. So what's happening is, so at the end of the day, there is a non-stop inflammation which is going on and on and on. So what we need to do is we need to cut down all these situations so that the auto mechanism doesn't move forward. We need to bring it back to the neutral stage. That means harmony. Then automatically everything starts playing a very, very important role. So when you look at the genetics of epigenetic, there is a pro-inflammatory genes and regulatory genes. But these and all, I said, we will get back to your classes and then move forward. How epigenetic works, the external environmental, is there, your body response, and the DNA and the genetic modification happens. They respond, switch off, on and off switches already happens, and that's how we can handle your epigenetic and switch it off or switch it on. So now, to lead, there are little practical approaches which I am going to go, not detail, but I will. There are around 800 epigenetic factors. Out of that, today we have 200 epigenetic factors we can pick up, correct it, and then we optimize your health, and thereby let it be any diseases, we can actually have a control, and then we will be able to help the person to recover and recoup back. So 800 epigenetic facts. How many cells do we have? 50 trillion cells. Now, what are we going to do? To become healthy, you need to heal thyself. The word by itself. Now, are you going to heal thyself? You need to have epigenetic pathways of your cell. Thereby, you can heal yourself. Now, other than that, the latest what we are all going to do to go into the cellular function is, number one, I'm just going to show you what we are doing. The hair profiling test plays a very, very important role. It uses the bioresonance technology where we can pick up the epigenetic factors. This is number one instrument. I use it regularly. Now, other than that, definitely there are a lot of things I have done on this particular platform. I can give you a lot of information. I think when I do my classes, I will be able to let you know. And what we need to do is we need to work on epigenetic precision. So hence, it requires a lot of clinical correlation to the cell function. Next. Now, life is on. We all need to handle it in a proper way for us to move forward. All right. Now, with this 10 years in my epigenetic practice, it's been a beautiful journey for me to share these beautiful experiences. And we have 4 stages where we can handle all the epigenetic correction. These are the 4 stages.
Hi, I'm Linda. I was referred to Dr. Prabhu for the treatment.
This is my client. It's going to be a
hardly
30
the
minutes.
hospital
Just listen.
5,000 mg of medication, but my condition worsened and the dosage had been increased to 2,000 mg due to breathing difficulties. I was referred to Dr. Prabhu at Epigenetic. Under Dr. Prabhu's expert cares and treatments, my health began to improve significantly. Within a year, my medication dosage was gradually reduced by 500 mg, and eventually I was advised to continue it completely. I was initially very anxious, and I had heard that many autoimmune patients must remain on lifelong medication and often face severe side effects. However, with Dr. Prabhu guidance and treatment, I have made a full recovery. By God's grace, I am now living a healthy, happy life with my loved ones. I'm deeply grateful to Dr. Prabhu and his entire team of Epigenetic for giving me a new beginning. Significantly, within a year, medication dosage
here
was
what's
gradually
happening
reduced
is,
by 5,000.
so I'm sorry, this audio, I just put it inside.
To continue it completely.
I don't know how to stop it.
Very anxious,
But
and
anyway,
had
what I
heard
need to
that
let you
many
know is
autoimmune patients
epigenetic correction
must
plays a
remain
very,
lifelong
very important
medication
role.
and often face severe
And
side effects. However, with Dr. Prabhu
So,
guidance and treatment,
wishing
we had
everyone
better
down here
recovery.
good luck
By
and a
God's grace,
prosperous.
I am now living a healthy, happy life with my loved ones. I'm deeply grateful to Dr. Prabhu and his
So my
entire
humble
team at
request is,
Epigenetic for giving me
very
an
sorry this audio is going on. I don't know how to switch it off because I just put it in. So my humble request to every one of you who have not joined our academy, please join our team of academician inside, and from the epigenetic part, from the Department of Epigenetic, I welcome you all. Please join us and then learn the techniques of epigenetic correction, and let's all live a healthy lifestyle. And thank you very much for giving me this wonderful opportunity. My humble apology for delaying a little bit. And I believe in the future, we all can work together and I can exchange a lot of information with you all. Thank you very much. Have a wonderful day.
Thank you,
Thank you.
Dr. Kumar. That was awesome, as always. And yeah, you made it a little bit short today, but we have 2 days to go, Dr. Kumar. You can still continue. We can still continue. I have 3 presentations. We can have more presentation. So it doesn't have to go with, just one schedule. Because Dr. Leonard is waiting for his presentation. Dr. Horowitz, thank you so much for joining us. I would like to make a comment on Dr. Kumar's presentation on what he does. The reason that we are together because we have the same perspective, we have the same view on the healing, and what he does in epigenetic is exactly what the father of homeopathy, Dr. Hahnemann, said. Dr. Hahnemann is who developed the homeopathic system of medicine, full-fledged system of medicine 250 years ago. He said, no medicine, the best medicine, the correct medicine, the correct potency, whatever, does not work if these factors that Dr. Kumar said do not exist. So epigenetic is a foundation, it's like nutrition. It's a foundation of health, So that's why, we are working together, right? So, I mean, epigenetic is something that is very important to consider when, as a practitioner, that you work with any system of medicine, especially if you work with homeopathy. Because, as I said, Dr. Hahnemann mentioned it in Organ and After Medical Art, that it's very, very important to consider everything that he said: detoxification, nutrition, all this, deficiencies, lifestyle. These are all the branches of the health, So that's why, homeopathy is very compatible with what Dr. Kumar is teaching. And thank you so much, Dr. Kumar, for being part of Quantum Academy, and he's the head of epigenetic department. And so we have a long way to work together. And thank you, everybody, to listening to his wonderful presentation. Okay, Dr. Leonard Horowitz, we always miss Dr. Leonard, so we always love to see him, but we see him only on webinars and conferences. So amazing to see you. And yes, I think Dr. Allah is back to you and to introduce Dr. Horowitz.
Thank you, Dr. Prabhu Kumar Raju. And now we are waiting to hear the speech from Dr. Leonardo Ruiz. Dr. Leonardo Ruiz. He is DMD, MA, DNM, and MPH, American Board Certified Practitioner, energy medicine expert, and electroceuticals pioneer, advocate of frequency therapeutics, author of 28 books, Department of Integrative Medicine, and webinar and conference associate lecturer at the United States. And today's topic is really interesting. And now he will speak about 528 frequency photoacoustic bioenergy and therapy supersets, pharmacology, and Western medicine. So we are waiting to hear from Dr. Leonard. Dear Leonard, do you hear me?
Yes, I can hear you fine. How are you guys doing today? Very nice to join you.
Yes.
Great to
Now
see
you
you, Dr. Leonard.
All right. Shall I begin?
Absolutely. We are waiting for you.
Oh, okay. Well, thank you. Yes, Dr. Kumar, I really appreciated your presentation, and likewise, Parvin, your presentation is wonderful, befitting to what I'm actually about to share. So the presentation I've prepared for today is 528 frequency photo acoustic bioenergy. And that this supersedes, exactly as you were speaking about, both of you, the concept that Western medicine is better than Eastern medicine. And I think that that is something that is ridiculous, absolutely insane, frankly. My presentation deals likewise with cancer. Because I'm now a survivor of cancer. I was 2 years ago, I was diagnosed with a COVID cancer, multiple myeloma. I was given 5 years to live. And largely what I did was I got myself a very wonderful expert who shared my own philosophy and understanding of natural medicine versus allopathic medicine, or the slash burn and poison paradigm. And I was advised to not do certain chemotherapeutics, but at the same time, I educated him and others who were involved in my treatment plans about 528 frequency, which this presentation is about. The references that I'm about to share, you don't need to take really notes, because if you go to medicalveritas.org, you could read 3 scientific peer review articles that I published based on my own diagnosis of multiple myeloma and how it is, what is the pathogenic process by which the spike protein antigen, the bioweapon, the nano, neuro, bio, electronic devices that are associated with this and the spike protein antigen, this actually induces the mutagenesis, or the cancer induction, and going haywire, just like Dr. Zoran had talked about, cutting off the natural flow of energy. And that's really inappropriate if one wants to heal. So to restore the natural energy is really exactly what my predecessors here have talked about. And I refer you to medicalveritas.org, which has these publications listed on it. And it is, I'm the editor-in-chief of Medical Veritas, and I'm very proud and honored to deliver this intelligence that's being heavily suppressed internationally. I'm showing you this chart. It's on my desk. I'm working on this project right now. It's obviously complex. It's an organizational chart of the US-China biotechnology enterprise, the racketeering criminal enterprise, which has brought us these plagues, including COVID-19. You can go back to HIV/AIDS, but you can basically see how complex it is. There's listed here 30 individuals and or agencies that are incriminated by the solid scientific evidence that has been published insofar as the lab creation and then the cover-up of the laboratory creation, claiming that this was natural, or today the controversy between the United States and China as to who's responsible. My conclusion is that they're equally responsible, equally accountable, and in fact, the global industrialists that control virtually all the intelligence agencies, including MI6 in England, including the CIA in the United States, also the CCP, the Communist Party's intelligence agencies, they're totally complicit. They are operating together. And this next slide basically is too complex for me to deal with in this brief presentation, but it deals with how it is that we, the people, buy into this criminal hogwash, that mind control, literally social engineering us to believe whatever they want us to believe. It's a behavioral science technology that they utilize. The most advanced research and developments in mind control, behavioral engineering is also what we're looking at when we're starting to talk about now about photoacoustics, electrogenetics, or epigenetics. You're dealing with the most advanced research and developments in this field of human population control. And the whole thing, in my opinion, is satanic. It goes beyond criminal psychopathology. You can't actually, ascribe what is taking place on this planet to simply profiteering off of humanity's suffering. No, you've got to look at exactly what it is that the subject matter today, whether you're dealing with homeopathy, which is a resonant energy, a frequency delivering technology, that water, which is a liquid crystal superconductor of sound and light, holds memory, especially when it's a special type of water called structured water. And so much of what I recommend is exactly what Dr. Zarin recommends, that we engage in how it is that actually God works. How does nature work? How is nature designed to work naturally? And then, of course, what's the impact of that on genetic expression, what's called epigenetics? And essentially, this complex chart is what I've put together to document who, particularly, what agents and agencies in the world control mass media, control mass minds, and have unfortunately delivered us to evil in the current situation in terms of public health. I'm going to focus on 528 as a natural healing constant. There is, in fact, let me see if I can get it here. Yeah. So as a natural healing constant, how did I derive that? I'm going to briefly discuss that. But basically, it's exactly as Dr. Kumar has just talked about. It deals with epigenetics. It's exactly as Dr. Zarin has talked about, how by nature you have a genetic strand that, in my opinion, I conclude is an antenna to God. It's literally what it is that naturally, miraculously manifests healing. And how does it do that? Spiritually, well, let's not go off the scientific subject into metaphysics. We don't need to. When we understand what is spirit, it's energy. What is energy? It's all negatively charged electrons that are vibrating at certain frequencies. And I'm claiming, and there's a massive amount of evidence, that the 528 frequency in particular is an extraordinary therapeutic resonant energy. Here, I refer you to a peer-reviewed science article I published in June in Acta Scientifica, Biotechnology. It's my first biotechnology. I have dozens and dozens of scientific peer-reviewed publications to my credit, by the grace of God. But this was my first biotechnology publication, and it goes through the entire virtually explanation of why it is that 528 frequency I consider the constant, literally the universal constant for a grand unification healing paradigm. How it is. What's the big picture? What's the large dynamics? What is the interaction of all of the elements in nature that permits me to say to you that there is one frequency? I call it love 528. Love being the universal healer, 528 is the miraculous healing frequency. Why do I say miraculous? Is because this goes back to ancient knowledge. This is ancient Pythagorean mystery school information intelligence. The third note, as you can see in the lower left portion of the screen, is the mi note. Today we have do, re, mi, fa, sol, la. It used to be ut, re, mi. The Roman Catholic Church, this is the Latin technology for mi. Mirigistorum is the third note of the original musical scale. The third note is 528. And most incredibly, over the last year and a half or so, science in the realm of plasmonic science. That's a whole virtually new field. Plasmonics, plasma, what is it? It's spirit, it's energy, it's ether. Ether. You can't see it. You can't hear it. You virtually, maybe you could taste it a little bit, but basically it's vibrating spirit energy, it's negatively charged electrons, and gold, pure 24 karat gold, vibrates on its surface plasmonic resonant energy at 528 specifically. What is that? That's the heart of sunshine. Oh my goodness. The heart of sunshine is the heart of rainbows. What is that? Oh boy, that's interesting. The heart of sunshine, heart of rainbows is why grass is green, why we live off the breath of the Creator, how God got Adam and Eve, says the Bible, off the ground. He breathed the breath of life into Adam and Eve, and they became human, animated. So what is that that's animating us right now? It's negatively charged electrons associated with oxygen, element number 8, oxygen, which is produced primarily where? It's produced by chlorophyll. This whole concept that 528 frequency chlorophyll is the resonant energy at the heart of sunshine. Vitamin D production, boosting immunity, antioxidants, this whole concept of negatively charged alkalizing electrons. Cancers don't do well, if at all, in an alkalinized state. Why? Because it's full of antioxidants. It's full of negatively charged electrons that by nature, at the heart of nature, heart of sunshine, heart of rainbows, heart of your heart, my heart, and in fact, heart of the musical, mathematical matrix of divine design and universal construction. So right now on the screen, you see 9 core creative frequencies in what I trademarked called the perfect circle of sound. The perfect circle of sound. Everything in the universe is circular. It's circular. And Galileo was not the first person that said that the earth is round. No, this goes back to ancient Greek Pythagorean mystery school. Mystery, it's been kept a mystery. It's been kept concealed until now. This information is revealing. It's revelatory. So you had Pythagoras, Plato, Aristotle, Vitruvius, Da Vinci be engaged in this field of Pythagorean mystery school mathematics, and they claimed by observing nature how everything is mathematically frequency based, everything, all universal construction. And so where do we get our oxygen? We get it from the chlorophyll, which is like a carbon 6. It's the hexagonal shape, 5, 2, 8. 5 plus 2 is 7, plus 8 is 15. In ancient mystery school Pythagorean mathematics, you reduce the multiple digit integers into the single digit integer. So 5 plus 2 plus 7 plus 8 is 15. That's 1 plus 5, and 15 equals 6. Now you understand the basis of carbon 6, organic chemistry, the molecular structure of life, what's necessary. And why is it that sacred geometry of a carbon 6 Star of David snowflake, all snowflake, likewise designed? When bees in honeycombs buzz, they're singing 528 frequency, and they're producing beautiful honey in 6-sided hexagonal shaped honeycombs. It's like obvious. It's like this is what the basis of what science is about, because the first science book in the world was Aristotle's book called Physics. What was the root word of physics? And here we're talking about biophysics for cancer therapy, for homeopathy. What are we talking about? literally the energy that is pure love. Physics, the word comes from philos, meaning love. So we're talking about love 528. The extraordinary benefits of 528 is it's linked to the heart of everything. As I mentioned, there's a musical mathematical matrix of divine design and administration. And when you go to sleep at night feeling tired and depressed, and you had a hard day's work, or you're a cancer patient and you go to bed and somehow in the morning, miraculously, you're feeling much better. If you simply ask what by nature happened, what happened is all night long, by the grace of God, by the grace of the musical mathematical matrix of divine design that's vibrating in certain frequencies to maintain the balance universally, with 9 core creative frequencies only. Everything else is harmonics off of the basic fundamental 9 core creative frequencies that I just showed you. But basically, this is what happens. It's exactly as Dr. Zoran had just talked about. It's like you either block the energy coming in, and if you block the energy coming in, then you die. Or you supplement the energy coming in through homeopathics, through electrogenetics, through bioacoustics, through the plasmonics, the understanding of how God works. How are we designed as natural beings? So it plays, this 520 frequency plays at the heart of the solfeggio, but it plays at the heart of everything. It's fundamental to pi, phi, the Fibonacci series, golden mean. It's required for space-time measurement in physics. It's paramount to all of sacred geometry. All of the circles and squares and whatever, triangles, it's triangular. Nikola Tesla said the 3, 6s, and 9s, if humanity, this is his quote, if humanity only knew the powers of the 3s, 6s, and 9s, it would be a completely different universe. Why did he say that? Because this is ancient mystery school Pythagorean mathematics of how God works, the construction of everything, including the restoration of your body. So this is central to water structuring. Homeopathy is based on water structuring. What is water? Water, especially structured water, it's a sacred geometric form of God's presence. Go back, I call it actually liquid God. Go back to Genesis 1:1 through 1:8. Water is mentioned even before God is mentioned. It was the Holy Spirit, spirit energy of God that hovered over the face of the water, divided the water from the water into which the words, "Let there be light," was spoken. Out pops the sun. Water is a liquid crystal superconductor of sound and light. That's how homeopathy at its basis works, because also it's in communion divine with your own resonant energy of your body, because your body is a Holy Spirit-filled temple that's about 80% water, superconductor of that Holy Spirit power of love that the science world calls plasmonic energy, etheric energy. That's that Holy Spirit power that does all the healing. It comes in and it turns you on. It turns everything on, from the stem cell differentiation, as we'll talk about briefly to come. So you have water structuring, which water structure is the molecule itself is a tetrahedron structure. It's a triangular, 4-sided equilateral triangular structure, and it always seeks a mate because of the polarity. So when it forms its mate with its other second molecule, the 6-sided hexagonal shape forms. That's how we got the Star of David. The Star of David in Judaism, what is that? It's an amulet for divine protection. That's what the Jewish star is, the Star of David, or Solomon's seal, it's called. Key to beneficent heart of God, sustaining us freely, miraculously, naturally. It's also, I claim, I've been claiming this for about a decade now, especially to the Jewish orthodoxy in Israel. Isaiah 22:22 and Revelation 3:6 through 8. It is the key. Those are the Old and New Testament prophecy that a very special key of the house of David, fundamental to the Jewish star, Solomon's seal, the key of the house of David that opens doors that no man can open, closes doors that no man can close. What is that? That's metaphysical portals for the divine intervention and the divine communion. And that's enlightenment. That is what happens when we expand our consciousness to the degree where you have the intelligence to make wise decisions and realize, yes, there is a God. In fact, it's been proven now in science. My colleagues, Dr. Vernon Neppy and Edward Close, brilliant mathematicians, have published numerous articles mathematically proving the existence of God, and even more incredible, the continuation of the soul, which is an energetic structure, or it's an energetic device that the Creator has created to be in touch with us consistently, and that it's programmed mathematically, vibrationally. The soul, which is what Jesus' whole ministry was about, is saving souls. Well, what's a soul? What do you want to save? You want to save the part of you that is godly, the part of you that's connected to God, the part of you that miraculously heals and produces wonderful things for the planet in social service and divine service, which is what God is a parent. If you're a mother or a father out there, you know the best part of your life is having your children come home, let's say from school, and showing you wonderful creations. What have they done that you can be so proud of? Likewise, God is the same way. You know, He relies on us and celebrates us, created us to bring home wonderful news about blessings of how we should be living instead of the insanity and the hypocrisy. Exactly like Jesus said, turn over the money lenders at the temple, the hypocrites at the temple, turn it over, get rid of it. This is what you're saying, Dr. Zarin. This is what, Dr. Kumar, you're talking about when you're talking about getting out of the insanity and the hypocrisy and the demonic possession and literally the addictions of drugs and the intoxication of vaccinations. This is insane. So Jesus would say, stop it, get rid of it. And that's what we're doing here today. So it's the key of the house of David. It resonates at the heart, I said, of snowflakes. It's the design of snowflakes, of sacred geometry, of organic chemistry. It's central to Genesis. It's central to green grass, what we're living off of, chlorophyll. Interestingly enough, in your blood is hemoglobin, delivering oxygen. And what's the structure of hemoglobin? It's virtually identical to chlorophyll. The only thing that's different really is that human beings, we have iron. But chlorophyll is green because it has the magnesium at the heart of the same molecule, virtually, very close. So it's linked to the heart of heartfelt emotions. What? What do we have in our hearts? What's the vibration of love? 528. It also has faith. Faith. That's a critical key. It's like one of the keys of the house of David, because it's only by faith that you have a relationship with the Creator for restoring health. Now, think about how this is applicable to clinical care in patients, particularly cancer patients. They've been pronounced, I was given 5 years to live. Now, as of 2 months ago, I'm completely cancer-free, says the doctors and says the testing. So, but what this whole concept is, if you have a patient who has no faith, nor faith in even their own survival, and their will to live is shut off, they're compromised by the behavioral insanity and hypocrisy and the social engineering of insanity, mind control, and they believe that the doctor who says you have 5 years to live believes that, oh my, now it looks like I'm going on 5 years. I guess I'm going to die now. What insanity. That's crazy. So anyway, it's the miracle note. 528 is the miracle note of the universe. Now, interestingly enough, it's the natural sound that we make when we yawn, when we laugh, when we sigh, scream, and even the holy names, the Yah, 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 Ha, the Yah names, Aha, revelation, it's all that frequency of 528. So in essence, the Creator has endowed on us a memory that even our language is frequency, energy, it's creative technology, the lips, the labiatum, do, re, mi, fa, sol, la, the labiatum, the lips are the creative instruments. So that's why when you think negatively and you speak harshly, it's damaging. It's going right in. It's like Jesus had said, you shall be judged by every word that comes out of your mouth. It either reflects the love in your heart or the evil that dwells therein. Think about applying that in medicine and healthcare, natural medicine. It's the essence of natural medicine. You've got to think positively, speak positively, because that's creative. It's a creative technology. Of course, your body, 80% water, liquid crystal superconductor, transmits that energy, whether it's negative, and then you literally do what happens when Dr. Zarin explains it. You're shut off. When the electrogenetics now, that antenna to God no longer gets that energy. So I subscribe to Eastern medicine far more and homeopathy far more than I do in allopathy. And this is a chart that deals with the chakra system. Obviously, Oriental medicine is far more advanced than Western medicine, and that there's energy centers, vortices in the body that when we are in tune, in harmony, in balance, and especially in communion divine, then that energy comes by a great blessing, by grace. It just comes and it balances our whole body. And so that's essentially where it's at. Now, I only have about 15 minutes left here, maybe 10 to 15 minutes. So I'm just going to briefly go through. I launched about 3 weeks ago, I launched 528therapy.com, 528therapy.com. And that if you go there, you'll have some links. Also, this is up on medicalveritas.org, my online journal. So if you go to 520therapy.com, you'll get a wonderful application for self-care, for self-help, to reorient you, to engage you in what we've been talking about. And this is a scientific publication to show you that, oh, Dr. Horowitz doesn't know what he's talking about. In fact, my gripe, my greatest beef, is that the researchers internationally who have taken my work and then independently proven the effectiveness of 528. Here is an article on the endocrine system. Improving the 528 frequency music then automatically affects your autonomic nervous system in very positive ways for stress reduction, for antioxidant activity. Here's another one by Delari et al. From Tehran University. Doesn't mention my work at all, takes my work, 528 frequency of sound waves and its production on increasing testosterone levels and the watching behavioral changes in rats just from frequency 528. Here's another one. This is from the Journal of Addiction Research and Therapy. The effects of 528 sound waves and its impact reducing cell death in the brain. These are astrocytes, primary cell cultures, and protecting against alcohol intoxication. So drug intoxication, where you're stealing alcohol, what is the chemistry? It's an OH, it's a carbon hydroxyl group, which ultimately then pulls, it robs the energy, the negatively charged electrons. So this whole concept of poisoning, there's a common pathway for all poisoning, and that is simply you're removing the negatively charged 528 love vibrating electrons that are trying to restore you by the grace of God, and you rob them by poisoning yourself with everything from alcohol to vaccination. Anyway, my principal gripe is that these guys don't acknowledge my work. My work has been so censored, outrageously censored. And you can understand why that would be. The pharmaceutical cartel would suffer extreme losses if they were to integrate the intelligence that I provide. I go into now this autistic issue. It's a great example. Here we now have the poisoning through primarily mercury toxicity that the Kennedy administration and MAHA has just supposedly removed from hepatitis B vaccines. They've been lying all these years. They said to us 20 years ago that they were going to remove the thimerosal preservative in the hepatitis B vaccines. They lied. They had it in there. They lie about everything. There's nothing honest that they have done, especially as I'm now working on this whole expose of the racketeering enterprise that brought us COVID. They've lied about everything. So they lied about the mercury toxicity and the vaccinations and intoxication of our children. And now we have devastating damage, devastating economic and socioeconomic, political. Families are devastated. Special education needs for massive amounts of autistic brain damaged children. So let's get into this as an example. You know, you have this concept recently. It was stated by Kennedy administration, Trump administration, that the principal problem with Tylenol, taking Tylenol around the time of birth, is that you reduce the glutathione. Glutathione is the principal immune booster in the body. It's the principal immune booster because it is, again, the deliverer of the negatively charged, oxygenating, alkalizing electrons. Wow, wonderful. You know, when Dr. Kumar talks about literally bringing your DNA back to life at methylation, there is the similar process that's taking place here. You have the negatively charged anion, the anionic form of methylation. That is what delivers the same thing I'm talking about that oxygen delivers by nature for boosting immunity. Now, this is the electrodynamics of autism. You know, and this is why acetaminophen, Tylenol, which destroys, along with mercury, along with alcohol, and likewise stress, psychological, emotional, behavioral stress and distress, destroys and depletes the negatively charged electrons in the body, the spirit of the body. You reduce glutathione levels, and that has an impact, negative impact on reducing immunity, lowering your energy. You're tired all the time. You lack antioxidant activity. That means you now are susceptible to infectious diseases. You get sick, you get colds, flus, and then basically it also challenges the brain when you lose your energetics of your brain. Here's chemistry proof of what I'm talking about, of the glutathione. You're looking at a oxygen which pops off the side and is responsible for negatively charged electrons, rejuvenating the antioxidants, entering the body and bloodstream again. This is the function of glutathione. And I mentioned briefly, where do we get this in nature? We get it from water. We get it from sunshine, the heart of sunshine, 528. And so this is vitally important intelligence for natural medicine and natural healing. So neurological functions of glutathione in the brain is what we're talking about. If you look at the concept of restoring energetics to the brain, look at the effects on autistic children, the benefits of hyperbaric oxygen therapy. Look to oxygen as the restoration. Now, recently, I was rejected from the federal court, Superior Court in California. Elon Musk filed a lawsuit against OpenAI and Microsoft, Bill Gates. He did that because he gave them $200 million to start the whole chat GPT industry. And then they basically threw him out. They damaged him. They defrauded him. So he sued them. And I had entered the lawsuit. I had attempted to enter the lawsuit. And my challenge was when Elon Musk said to the court that this technology of artificial intelligence and robotics is in the wrong hands. That's his language. And he basically states that humanity is on the verge of extinction because of the corruption, having this technology evolve in the wrong hands that have already polluted and intoxicated civilization, that allowing them to continue to advance AI and this whole even concept of transhumanization, post-humanism. What is that? Where you're getting injected via vaccinations, mRNA vaccinations in particular, with the nano, neuro, bio, electronic devices. So this is a slide that I posed to the court in attempting, and unfortunately, or maybe fortunately, I was rejected by the court. I was not able to join that case, but I put my message in there. This is a slide that shows you really where the action is in neurology of the brain, in autism or other issues such as Alzheimer's. You have a neurosynaptic gap junction. In this space is where the action is. The allopathic chemical poison paradigm says that the chemicals go from one nerve to the other, and that's how transmission occurs. I'm saying hogwash. You have a life force that's principle within that synaptic gap junction, and that life force is principally in that green color of love, 528 energy. Now, this goes into the most advanced understanding of stem cells. This Dr. Kumar talked about in really causing them to differentiate it, to replace damaged tissue and cancers with normal cells. The pluripotency of the stem cells, undifferentiated, can grow. Well, study the research science. The most advanced science in stem cell differentiation now shows you exactly what we're talking about. It's all energy mediated. It's frequency, vibration mediated. The cells are picking up, the undifferentiated stem cells are picking up God's energy, first of all, and by the genetic design, DNA, as an antenna to God, which has the constructive diagram of the way the tissues and cells should be manifesting in accordance with God, in accordance with nature, then what happens is that the stem cells are getting not only God's frequency resonant direction, but also the healthy tissues surrounding wherever the healing is needed. Those cells in a communication, sound and light communication of DNA is sending out the signals to the whole community for divine communion, communicating this essence of here's what cell you need to produce new tissue. And that's how healing works. So on the website I mentioned, the 528therapy.com, you'll see, and also on Medical Veritas. If you go under Medical Veritas, you'll see a bioenergetics. You'll see a bioenergetics section that has science articles for green light therapy. This is what 528 frequency looks like in a color swatch. This is what you can get for free on 528therapy.com. I encourage you to take your iPad or laptop, fill your screen with that green color swatch, and select to play the audio of either straight 528 frequency or the binaural, the 417, which is the silver plasmonic energy, coupled with gold plasmonic energy of 528. So you have 417, that's in the solfeggio, also the second note of the original musical scale. It's been determined to be the silver frequency resonant energy. So you're now taking your iPad. It becomes a therapeutic device. It's an instrument for free. I laid it out there. You can actually select either the binaural audio, you listen to it, and you hold the now therapeutic instrument, your iPad or your laptop, and you can actually feel the vibrations. It's going into your body. You are now being actually divinely communing with God's love and love, the universal healer. The theory is, this is consistent, by the way, with Rife, Royal Raymond Rife frequency therapeutic technology. So yes, you're getting therapy. Anyway, my store, where I show you how to integrate this into consumer health products. Go to healthyworldshop.com. You'll see a marvelous broad spectrum antimicrobial, antiviral, antifungal that basically resonates in 528 frequency, encouraging you to actually pray because your heart outputs faithful, loving intention in faithful prayer in 528 frequency. It's coming right out of your heart. The water resonance, the structured water resonance, water liquid crystal superconductor. So you have a superconductor in oxysilver with 528, broad spectrum antimicrobial, alternative to toxic antibiotics and deadly vaccinations. So now you've got a superconductor of the water. You've got silver in it. Nanosilver is a superconductor of electronic energy. So electrons are superconducting. And if you're smart, you'll do what I do. I'll take maybe at the first sign of a cold or flu, when I think I might be coming down with something, I take 3 capfuls with prayer. Bingo, gone. No disease. It disappears in seconds, literally, and it's over and over again. It took me years to kind of even think about how is it that this particular product is literally prompting all of these miraculous healings. The result of my inquiry is what we're talking about here. We're looking at the grand unification theory of natural healing in 528 frequency as the universal constant. So this is a field called electroceuticals. Electroceuticals. When Dr. Zarin talks about homeopathy, she's talking about an electroceutical. That's what homeopathy is. Vibrating the resonant energy, ideally of love, the universal healer, in that frequency. And that's precisely when the homeopath succusses, they shake the homeopathic before they give it to the patient. What are they doing? They're doing it from their heartfelt, loving intention and faithful prayer. And that energy is going out into the liquid crystal superconductor of sound and light, the homeopathic solution, universal solvent, water, and that energy then goes and it matches then not only God's energy, because that God administers with love, so a loving practitioner, faithful practitioner, shakes that, succusses it with a prayer and for healing the patient, and then the patient takes it and it communes with their own body water. It literally goes into the body, then it's supercharged because, again, water is a liquid crystal superconductor. Rapidly goes through all of the whole body, all of the cells, all the tissues. They all get that same wonderful healing message. How miraculous that is. So I highly recommend people experiment with oxysilver, and I think you'll be totally thrilled. Finally, in closing, the greatest concerns today deal with the vaccination intoxication from what has been heavily suppressed and denied by officials worldwide. that graphene, they claim, which look at the structure. It's a single layered carbon 6 framework, that this is injected via the vaccinations, particularly the newer vaccinations. And it is the technology, the most advanced Harvard and MIT technology for advancing this mind-brain cloud connection, the mind control, population control. The most advanced technology is in the injection of the graphene nano neuro bio electronic devices that permit wireless communications between a human being's brain and the cloud. That's the issue. And clinicians all over the world are saying they're seeing patients who are troubled with various illnesses that, like Dr. Kumar talked about, the autoimmune diseases, that's another huge issue with vaccination poisoning. But this is the newest one, the latest one. So I produced a product actually years ago, before all of this. And here is the ingredients. The principal healing therapeutic ingredients is humic acid, fulvic acid, humus, soil, which resonates with the electrons, which all of the elements have the electron resonance. But soil is extremely beneficial, says who? For eliminating graphene poisoning. The Chinese government financed studies showed that the, quote, antidote to graphene poisoning is humus and fulvic acid. So years ago, even before COVID, I came out with Zeolove that has both the zeolite, which is a chelation agent. It pulls the heavy metals and toxic waste out of your body, but also supplementing it is with humus and fulvic acid. So that's a great product. Then when we start to talk about homeopathy, look at 528, CBD 528. CBD, we know, people have been saying, oh, this is wonderful for various issues, helps you sleep, helps you heal, helps you reduce stress. Well, why not use it homeopathically? And that's what I did. And I coupled for pain relief and elimination of depression, because chronic pain patients are typically depressed. So homeopathically, I've prepared a remedy that addresses both the pain as well as the depression. Go to Healthy World store, read it, read about it, read what's in the ingredients. For literally, you have to boost, like I talked about earlier, faith and trust, as well as this concept of choosing health, of feeling that you want to live. This whole concept, if you are a chronic pain patient, a lot of these people want to commit suicide. So to get beyond that, you need a behavioral homeopathic, and a no-so that delivers positive self-esteem, self-image, self-mastery, success capability, so that you can feel successful in overcoming this issue. That's how you literally administer and apply the holistic model: body, mind, emotions, imagination, intuition. Most importantly, the will to live, will to heal, the will to survive, basically, and thrive, which is a choice. It's a choice that's ideally based on education, understanding. It's a choice that's based on informed consent, your will, powerful will. That is what we clinicians need to impart upon our patients for optimal benefits. There's a fantastic product, last but not least, is Liquid Dentist. Reverses tooth decay, reverses gum disease. And it does that using solid science, but it does it all naturally. All organic compounds that you can feel is wonderful. Organic essential oils, the wonderful essential oils, wintergreen, spearmint, peppermint. Mouth feels wonderful, but in the same time, you've used this understanding of technology, and particularly 520 frequency. The Liquid Dentist actually begins with oxysilver. It's 3.5 approximately parts per million. Oxysilver is the beginning of Liquid Dentist. So, really we have a difficult time keeping up with sales. If you're going to order Liquid Dentist, please allow on certain points multiple weeks before you can have your order fulfilled. And then 520 Therapatches. Study these. They're fun to play with. They're literally utilizing the acupuncture understanding how putting negatively charged electrons into the body. The 520 Therapatches, as I've talked about, gold and silver, 528 and 417 frequencies. This has a layer that's on a disc magnet. The magnetic field pushes the frequency of 528, particularly through, and silver and gold, through a capacitor layer. It's called a capacitor layer. And it's got crystal quartz crystal, which again, computerization, silica-based, crystal-based. So you've got crystalline structure capacitor that has gold, silver, and is memorized the 528 frequency. Yeah, they're fun to play with, and you can be amazed. It proves to every patient the pain goes away, the pain disappears. How did that happen? Miraculously. This is God's technology. We should understand that that's what it is. Anyway, my particular website is numerous, drlenhorowitz.com. That's under, unfortunately, trolls have hacked my personal official website, drlenhorowitz.com, but the numerous other publications are still up on the internet. Anyway, that's the end. Thank you so much.
Fascinating as always. Unbelievable, Leonard. Anybody has a question before I make my comments on? Anyone has a question? Okay, I think Dr. Leonard is just brought everybody into enlightenment. So you all in a domain of unconscious mind. So amazing. I know Leonard, Dr. Horowitz for a long time, and we don't have much time to introduce him, but please just go and do some research who he is. He's originally is a dentist. Am I right, Leonard? Am I right?
Okay. I'm proud of the fact that for 16 years I practiced oral surgery and dental medicine.
He was a surgeon. He was a dentist. So I know Leonard long time ago from the platform, that the international platform. We were presenters. I remember he was, I saw him maybe sometimes when he was presenting. And from the beginning, I said, whatever he says resonates with me. It was everything what he's saying was resonating with me. And then I realized that whatever he's saying is resonates with homeopathy. So then homeopathy is something that is endowed within my life in terms of not only the truth behind it, but how it works. Generally, how it works. So what this Eleanor just says is the human body is a electric device, entire, from the brain, heart, the gate of the cells. It all works with electricity, and we are like a what you call it, electromagnetic device. So, and when we say harmony, disharmony or homeostasis or whatever, as Dr. Horvath just said, almost 80% of the human body is water. So imagine when the 80% of your body is not with you, it turns against you. The rest of the 12%, which is the solid materials such as amino acids, carbohydrates, and all those minerals and everything, okay? The rest, 4% is fire, and 6% is air, and 8% is ether or space, okay? This is the ancient philosophy that is never changing, it's the same. So if you see the components of the human body, the 80%, 75%, 80% water, and the rest just break it down. It's exactly the same components of the earth. Everything, like we have 80% ocean water and 12% solid on the earth, right? So it just proves that we are absolute part of the nature, okay? And when it comes to the human body, that is an electromagnetic device, when we want to bring it into harmony and homeostasis, we have to work on that particular domain, but that particular field, we call it biofield, okay? So when we bring it to harmony, what does it mean? It means to bring that 80% of water into harmony. The rest of 12 solid parts and the rest, it exists and it is not changing. It's a part of the biochemistry. But what we do with homeopathy, we work on that part, the biofield, 80% of water to bring you into homeostasis. What Leonard just said, to 5 to 8 frequency, which he calls it love frequency, he calls it healing frequency. That's what we do with homeopathy. Homeopathic medicine brings your equilibrium, homeostasis, to the love frequency, which is 5 to 8. That's the time that healing takes place. So that's all we have to do. We're not working with the 12% or the solid. Yes, we work with the deficiencies, but deficiency, even if you remove it, but the biofield or electromagnetic field is not in a right field, is not in a right frequency, nothing is going to get healed. So the 5 to 8 frequency, that Leonard is an expert on it. He talks about it. He has so much research on it. He has done so much. He's the author of 28 books, and all based on this. And it proves how homeopathy works. It bringing the body's frequency into the love frequency. Love means healing. What happened to the cancer patients when there is no love and the body goes against itself? Self-sabotage. So that's all we have to do, bring the body into the right frequency. So that's a time that you love yourself, your cells love you, and the collaboration, communication, and everything within you is based on that frequency. And you love what you do in the outer world as well. So that's called balance. So homeostasis within you and balance without. So thank you so much, Leonard. Dr. Hurwitz, amazing presentation. And please, everybody, especially scholars, students, please go and read Dr. Leonard's books.
Thank you. Dr. Zorn, I have some questions. Will the video that I just shared be made public and available to myself as well as others?
Actually, we'll be immediately, after the conference is over, we're going to upload it to the Bioquantum Academy's YouTube, and it's going to be public for everybody.
Wonderful. And then one person wrote in that they